Gee, and I wanted to have such a clean, crisp section of the first part of this meeting. Oh, well, that's life. Oh, okay. Marlia says she can't hear me on Facebook now. Okay, you guys on Facebook, how are you? How is this sound? It was working a minute ago, Marlia. I haven't changed anything on Facebook. So, okay, hold on a sec. Mary says, I wanted to take your Alla product, but the Desert Harvest dosage recommendation for several months of treatment with high doses, I take PEA separately. I don't know what the quercetin does. Thanks. So you have to remember that when I went through and got my pharmacology degree, which is a drug development degree, they taught a very important concept. It's called the lowest effective dose. What's the least amount of medication you can take and still get a beneficial effect? Now, the harsh reality here is that most not most, about 40% of IC patients have central sensitization, widespread pain. We have a very, very sensitive nervous system. We are very sensitive to chemicals. Nicole says better. I'm so glad. We are very, very, very sensitive to chemicals. And so for patients who have central sensitization, we don't do well with meds. We're the people who get all the side effects. And so taking a supplement is as scary as taking a med. I don't like taking meds. I am the queen of side effects to meds. And so what lowest effective dose means is what's the least amount of medication you can take to get a beneficial effect. Not the highest dose, it's the lowest dose. So as an example, with many of the supplements that I've tried in the past, like Sister Protect, I always say you start with one capsule, see how you do that for a couple of days. If you do okay, go to 2. If you do okay with that for a couple of days, go to 3, and so forth, to go up to the manufacturer's recommended dose. But I will tell you, when I tried Sister Protect, I could do 1 fine. When I did 2, I got loose bowel. When I did 3, I had diarrhea. I knew I couldn't do that, but I could do 1 just fine. That's the lowest effective dose. So concept number 1 here is more is not necessarily better based upon your unique anatomy. Sometimes less is better if you tend to be more sensitive. Now, the second thing we all have to understand is that how do I want to say this? I want to say this the right way. When I started the IC network 30 years ago, I was struggling because I had a lot of people saying, hey, take this, take this, take this, take this. I had somebody saying, drink the juice of a lemon every day. That'd cure your IC. Obviously, that won't do that, but that was the type of stuff we were getting back in the early days of the internet. And it's so much worse now. It's so much worse now. And I will tell you quite honestly, I did a lot of crying the first 5 years because I felt like I was just pissing people off. I couldn't get it right. I was always making people upset because I wouldn't support the fact that they were saying sleep on a magnet to make your IC go away. I mean, ultimately, I'm a scientist. My training is in drug development and science. And I was talking with a fabulous IC researcher named Tony Buffington. He was at Ohio State for many, many years. And I was kind of doing a woe is me, what do I do? What do I do? And he said, Jill, you need to use the Oxford Scale of Evidence-Based Medicine. I said, what's that? He said, well, this will allow you to rate the information that you're getting to see if it's worth publishing. So it's an A to F scale. And F is information from a company. Why? Because they have an incentive to make money, so they're going to sell you a product. And the more product they can sell you, the more money they make. So and the other F is the opinion of another patient, not supported by any research. So that patient who said, drink the juice of a lemon, it'll make you better. Okay, that's an F. A D is the opinion of a doctor, not supported by research. A C is a preliminary research study, a B is a better study, and an A is a double blind placebo controlled study. So I think that there's value in remembering that supplements are designed to make money for a company and they're designed to help patients. But there's always a little bit of conflict of interest there. I hope I'm saying that the right way. I disagree with taking high amounts of anything. I just do. I just do. I think it's about finding the lowest effective dose rather than the highest effective dose. But that's just me. You're different than me. You've got to make your own decision. So that's all I can say. So where am I on the scale of Oxford, the Oxford scale of evidence-based medicine? Well, my personal opinion is a D as in dog. Because I'm incredibly educated about IC and the science of IC. So I've earned that D. But when I'm talking about a supplement, I'm an F2. But when I'm talking about other things, I'm going to be a D. The CBAs are all based upon science and research, and I want to give you that science and research. So as an example, with Desert Harvest Aloe, they did a very, very small study of under 10 people years and years ago, which showed some success. Um, but we don't have any published studies that I'm aware of that have supported the use of aloe in the last 25 years. There's surveys and stuff that people have taken, but I like to look for published studies too. But the advantage of aloe is it has a soothing effect. Quite a few patients find it quite soothing for their bladder when they're in a flare. I think one of the most powerful moments that I had was a young boy who had very, very severe pain in his penis. And all he could say is, my pee pee hurt. He was like 4 years old. And his mom actually gave him a liquid George's aloe drink, and that's what made it go away. Aloe was quite soothing. But it doesn't fix anything because your bladder's not made of aloe. So instead, but there are some other beneficial effects that it has. Contrast that with Cystoprotec. Cystoprotec had a very large study of over 250 patients who took it 3 to 6 months, and that showed very, very good success in reducing the symptoms of IC. So I think the study behind the Cystoprotec was much stronger than the study behind the other product. So anyway, there you go. Karen here on YouTube says aloe has saved her. Good. I'm really, really glad. I'm glad. I'm really glad it helped. You know, I just put out a blog that talked about why supplements have a place in the IC community, and the number one reason is that for those patients who don't have access to health insurance, they've got nothing. For those patients who cannot afford traditional treatments, a bladder installation, some of the medications. Remember, Elmeron back in the day was quite expensive, hundreds of dollars a month. You couldn't afford it. And for those who want to kind of go a more natural approach, supplements create that option too. But there's a very interesting history in supplements. So the first supplement that was ever created was Pre-Leaf, which I started this meeting with. Laura, we'll get back to that for a sec. Hold that thought. So Pre-Leaf reduces acid in food. It was developed by AK Pharma, Alan Kligerman, the guy who invented Beano and Lactate. It's the guy who invented Pre-Leaf. Pre-Leaf doesn't do anything to your bladder. What it does is it reduces acid. So it neutralizes the acid in the foods you're going to eat. So if you're going to have to go to grandma's house and eat lasagna, you can take 2 pre-leaf and that'll neutralize some of the acid in the tomato. Pre-leaf is by far the most popular supplement. Hundreds of thousands of patients have used it in the last 300 years. I mean, in the last 30 years, not 300 years, 30 years. The second supplement that was created was CystaQ. CystaQ used quercetin. That research was done at UCLA by Dr. Dan Shoskis, and that was done by a company called Far Laboratories. Quercetin has an antihistaminic effect, and they had good, solid research that showed that quercetin was beneficial in reducing some of the symptoms of IC. Unfortunately, that company went bankrupt earlier this year or last year, and so a new company has it, and they're different product names. I haven't worked with them. So anyway. And then, of course, we had Desert Harvest Aloe. And the success of Desert Harvest Aloe really focuses on, in my opinion, the incredible kindness and goodwill of its former CEO, Pat Cressito, who was at every IC event. She sponsored everything she could. She was a friend of mine. She very, very sincere, determined, dedicated, and wanting to help patients. And so Desert Harvest Aloe had tremendous word of mouth in the IC community, and tens of thousands of patients have used that successfully. And then we had Cysto Protect. Cysto Protect became the first mega supplement because it had multiple ingredients in it. So it had chondroitin for the bladder wall, it's got quercetin as an antihistaminic effect, and it's in an olive kernel oil base, which helps it absorb. Dr. Theoharides, who was a professor, who's a doctor at Tufts University, was asked by the state of Massachusetts to investigate the safety of supplements. As he was doing that work, he is a uber geek in the best possible way. In fact, I just talked to him last week. Uber geek, incredibly scientific. He was going through these supplement safety issues and got this thought. Hey, I wonder if we can do something that would be helpful for IC. And he gave it a shot. And he started his company, Algonaut, and created Cysto Protect. So 2 methods of action, unlike the other ones, which just had kind of one core method of action. Cysto Protect quickly dominated the supplement market by far. We did the product launch for it. And it was very, very clear that it was helpful to some patients. Now, what was interesting, the first patient who called me back after trying it for a month said, "Oh, it's not really helping my bladder, but it's sure helping my arthritis." And it's like, well, that's interesting because it's got chondroitin in it. And glucosamine and chondroitin is often suggested for arthritis. Laura here on YouTube said Cysto Protect didn't help her at all because we're all different for sure. That's very, very true. Cysto Protect did not help me either. But of course, I'm pelvic floor driven. I'm not bladder wall driven. So that makes sense. But anyway, Cysto Protect was the top supplement for a decade. Thousands of patients have used Cysto Protect. Some successfully, some not so successfully, but at least it was available. And then the Algonaut sold the rights to it off to a couple of different companies. It went to Meta. It went to one company first, and then Meta bought that, and then Mylan bought Meta. And anyway, it was just kind of a lack of consistency, and they ended up putting a cancer warning on it. They didn't explain the cancer warning, and then it wasn't available for a year, and we were just screwed. All the patients who were using it really struggled. So Dr. Gio Espinosa in New York, he was the director of integrative medicine at NYU, created the next supplement, which was Cysto Renew, also no longer available. But it was the first supplement that contained chondroitin, quercetin, little tiny bit of aloe to soothe the bladder, and a little tiny bit of lemon balm to calm nerves down. And a lot of the old Cysto Protect patients had switched to that. And but they just didn't. They weren't. They just wouldn't. They weren't helping it. They weren't marketing or anything. Okay. So anyway, Sister Renew was struggling in a way. Sister Protect was definitely struggling in a way because we couldn't even get it. And then I went to another company, Natural Approach Nutrition, and said, "Help, help, help. I've got patients calling, crying because they can't get Sister Protect. Can you make it something similar?" And he went, "Sure." And that's where Bladder Builder was launched. So chondroitin, quercetin, um, some beneficial probiotics for the gut, and PEA to calm nerves down. And Bladder Builder is by far, right now, I think the best supplement on the market. But it doesn't work for everybody. And again, because we all have different phenotypes. If you're pelvic floor driven, bladder supplements make no sense. But a PEA supplement might help calm the nerves down from those tight muscles, maybe. They went on to create this wonderful group of supplements that um, are rigorously tested for purity. I've never seen a company so diligent in their work as I have with Natural Approach Nutrition. And so they've got Bladder Rest, Bladder Builder, Cystomend, Allopath, and Pura, and our low acid multivitamin Bladder Smart. So Nicole here on YouTube says, "I love Bladder Builder." Laura asked, "What was the cancer warning for on Sister Protect?" Well, the company never made an official statement, and that pissed me off royally. Mylan, literally, we had gotten a shipment of them, sent it out, and I had a customer call back and say, "Why is there a cancer warning?" I went, "What do you mean?" She goes, "There's a cancer warning on my bottle I've never seen before. We opened up a new case. All the new bottles had cancer warnings on them." So I called the distributor and I said, "What's up with the cancer warning?" They went, "What cancer warning?" They didn't know either. Then I tried calling company, nothing. Couldn't even find the Sister Protect product manager at Mylan. It was disgusting. So then I called Algonaut and I said, "Guys, do you know anything about this cancer warning on Sister Protect?" And they went, "Oh, really?" And I was like, "Yeah." I go, "It's probably about the titanium dioxide, the white food coloring in the capsule." So titanium dioxide is a white food coloring that has been found to, when it's in nanoparticles, to distribute throughout the human body where it causes cells to die. So titanium dioxide as a food coloring is actually banned in Europe. And there's a movement to ban it here in the United States. And Mylan was warned of that like a couple years before, and they just didn't do anything about it. So eventually, after I begged them on the phone and had a couple of meetings with them, they agreed to swap the capsule out to a capsule that didn't contain titanium dioxide. But it took a year to do that, and in the meantime, a lot of a lot of people were very disappointed. Rebecca says, "What about Bladder Ease? Is it a good product?" We sold Bladder Ease briefly. Um, the challenge that I saw with Bladder Ease is that the quercetin, I believe, was derived from citrus bioflavonoids, which made it potentially a little bit more irritating. So um, it never popped in the IC world as something that would be helpful for kind of bladder wall irritation. And of course, there are companies out there that are making millions suggesting that their cranberry supplement can help IC, and that couldn't be farther from the truth. Because of course, we have phenotypes. So we got the Hunner's lesions, we got the bladder wall driven chemical injury, we've got the bladder wall driven estrogen atrophy, we've got pelvic floor driven, we've got pudendal neuralgia, and we've got widespread pain. a one size fits all approach does not work in the IC world anymore. And now we know why, of course, many patients don't respond to bladder treatments, whether it's a supplement or a traditional therapy, because they have a healthy bladder, that their fundamental problem is beyond the bladder. Their fundamental problem is going to be pelvic floor dysfunction, a central nervous system issue, maybe endometriosis on their bladder, maybe fibroid tumors pushing against their bladder, maybe Tarlov cysts. I was working with a patient on Friday who had pelvic congestion syndrome, absolute pelvic congestion syndrome. I mean, she felt like she was carrying a bowling ball around in her pelvis. That is a classic sign of a varicose vein in her pelvis. So anyway, so the cancer warning got fixed years ago. It's gone. There's nothing to worry about. It's just a project now. And there hasn't been for years. That was fixed. But it created a lot of confusion. Lori, thank you so much for the 200 stars. I really appreciate it. So, Laura says she's taken Solaray non-citrus quercetin for 12 years. It's great. Very good. Laura D says, is Bladder Builder using low histamine probiotics? I've got IC, which triggered PFD and a mast cell MCAS disorder as well. I don't know. That's a really good question for the company. I don't know. Generally, so one of the enduring mysteries in the IC world is, why did some people flare when they ate yogurt or when they took probiotics? Because there is a small but significant subset of patients who flare whenever they eat yogurt. Why? Well, it was Gay Sandler who explained it to me, that probiotics in some people trigger a mast cell reaction. If you tend to be mast cell sensitive, then you might not do well with Bladder Builder or any probiotic until the mast cell condition is calmed down and improved. Let's see here. So, okay, so this is a good entry, actually. Okay, so I think the biggest breakthrough that we've had in the IC world, aside from the use of phenotyping and the recognition that quite a few of us have a central sensitization, that we've got an injury to our central nervous system. Again, that's the widespread pain subtype. The research done in 2019 on palmitoyl ethanolamide, also known as PEA, was phenomenal, because palmitoyl ethanolamide has been studied for decades in Europe for lots of different pain conditions: acute pain, chronic pain, surgical pain, shingles, IC, migraines, burning mouth syndrome, you name it, they've studied it. And I had heard about it for years. In fact, there was a pharmacist down in San Diego who was importing it on behalf of a urologist for his IC patients, because it was so good at reducing pain. But back then, 20 years ago, it was very, very expensive. It was thousands of dollars. So it really fell off of my radar, to be quite honest. It was way too expensive for patients. Well, a decade goes by, and they've improved tremendously the production of PEA. And then the Italians did this fabulous study with IC. And that study found, and it was presented at the 2019 American Urology Association meeting as a new research study in the IC poster session portion of the meeting, that showed that 87% of IC patients who went on PEA reported a significant reduction of pain and discomfort by month 3. And by month 6, some were completely pain-free. So PEA and no side effects. And you look at all those research studies. I prepared a really comprehensive report for the American Urology Association last spring. They're stunned at how well tolerated it is. It's not known for causing side effects, because it's basically part of your body's own pain fighting molecular cascade, chemical cascade. I'm not saying it the right way, but anyway, derived from eggs. So no side effects in the IC study, no side effects reported in the vast majority of studies out there, and no known drug interactions. Targeting very specifically not the bladder wall, but nerves. How do we calm injured, inflamed nerves down? Now, when I started this meeting, and Nicole says I'm a redhead and you're sensitive to me. Girl, let me tell you, we live with a whole level of sensitivity. So again, because I'm very reluctant to try things because I know how sensitive I am, I held off. We brought it in, introduced it, shared the research. Quite a few patients tried it. Ironically, I was struggling with very prickly skin, small fiber polyneuropathy, which is also found in the widespread pain patient. So when I was going to bed, I felt like I was being poked by pins all over my body. It'd be down on my foot, and then it'd be on my shoulder, and then it'd be on my back. And I'd have a big tub of CeraVe lotion in bed with me, and it was like I was chasing dry skin. It got really bad after menopause for me because, yes, sadly, I am postmenopausal now. So anyway, I was just really struggling with the skin sensitivity because there were some nights I couldn't sleep without Norco. Like I couldn't sleep, period. I was being poked by pins all the time. And then the PEA came out and I went, oh man, what the hell? I'm going to try it. I'm going to try it. And I'll show you. It's this PEA. Within a month, all of my skin sensitivity was gone. Gone. Shocking to me. I have been so sensitive for so long. I get maybe one pinprick a day somewhere on my body instead of hundreds. It's amazing to me. And so this is not me being paid to say this to you. This is me as a patient saying, hey, this really calmed my nerves down. And then when I had surgery this year, my first surgery, which was for my gallbladder, I made sure because I saw the surgical pain study for PEA. And so I made sure to try it, to be taking it before and during while I was recovering from surgery. That pain was amazing. They were shocked at how good I was doing. I mean, like 2 days later, I was up and doing stuff. My sister had the same surgery. She was in bed for a week. I was up and walking around within 24 hours. Why? It's amazing. But then, the breast cancer diagnosis and I had to have the girls removed, right? I had a double mastectomy on July 8th. So I made sure to be taking the PEA. And I will say it has been quite painful. And I shudder to think of what it would have been like if I hadn't been taking the PEA. I don't know if the PEA helped with this major surgery. I don't know. I will just say that, you know, recovering from a double mastectomy is rough. It's very, very rough. Okay. So anyway, I personally believe that the PEA addition has now changed the face of supplements in the ICU world and in the treatment world. Because we now have multiple studies done by universities showing it's helpful for pelvic pain and prostatitis also. So it's got a place. But now, my friends, woohoo, this is fascinating. Ow, oh, I just gave myself a paper cut. So we had another study from Italy, from kind of the same dynamic group of researchers studying lactoferrin. So, here, hold on a sec. I want to just read this to you because it might even be better than PEA, but it acts in a different way. Okay, so this is going to be really scientific. Bear with me. I want to read you what they say about it. But then I'll kind of simplify it. It says, um, uh, lactoferrin is a multifunctional iron-binding glycoprotein of the innate immune system, consistently synthesized by exocrine glands and neutrophils following induction. Lactoferrin is present in all secretory fluids in the human body, and its highest concentrations are found in colostrum and milk. And then they talk about the structure of it. Lactoferrin can scavenge free iron in fluids and in inflamed or infected sites, helping to suppress free radical mediated damage and reducing iron availability to pathogens like bacteria and fungus. Furthermore, the broad spectrum of functions exerted by lactoferrin is closely related to its high cationic charge at physiologic pH, which promotes the binding with anionic surface components of microorganisms and the gag layers of host cells. It is highly available and let's see, hold on. Hold on. Bovine lactoferrin, it's coming from cows, exerts a potent anti-inflammatory activity due to its ability to enter inside of the host cell nucleus, where it is able to interact with specific DNA sequences for pro-inflammatory cytokines, yada, yada, yada. There's definitive. Okay, anyway. So last year in 2023, the same research team proved that lactoferrin reduced recurrent UTIs. Recurrent UTIs, the bane of many women is, why do you get infections over and over and over again? Well, they proved in a study that lactoferrin helped to eliminate recurrent UTIs because it has a strong antibacterial and antifungal effect. It even has an antiviral effect. So this month, they shared a study they did with IC. A total of 31 women presented with the median of 6 episodes or flares of IC during the, let's see. Hold on. Okay. I want to get that right. I want to make sure I'm interpreting that right. Out of 31 patients, only 3 women had 1 flare in the treatment period. That means that 28, when they were taking lactoferrin, no flares, symptoms gone. There was a significant decrease in serum interleukins and D-dimers found after treatment. And cystoscopy revealed a global improvement in the appearance of the bladder, especially in terms of inflammation, irritation, and the presence of Hunner's lesions. So, the treatment was 5 capsules a day for a week, 3 in the morning, 2 in the afternoon, then 2 capsules a day for 30 days, and then 1 capsule a day before meals for 90 days after treatment. So anyway, I consider this another really, really big breakthrough. It needs to be validated in more studies. They have to apply phenotyping to it to see which group of patients is going to help the most. But I'm already bringing lactoferrin into the IC Network shop for people to try. No side effects, naturally found throughout the human body. And so there's a couple of things going on there. I hope I explained it partially well. I will have an article on this on the IC Network website soon. This is the first time I'm talking about it. I actually got the paper the week after surgery and I wasn't able to do it. Cystoscopy after treatment. Some women with suspected IC had cystoscopy. The bladder of the patient before treatment showed an inflammatory status represented by tiny vessels and concomitant presence of Hunner's lesions. After treatment, the bladder showed a decrease in inflammation, a lighter color, and Hunner's lesions appeared to have almost completely disappeared. You can get it. Well, so the formula used in the study is only available in Europe, although I'm talking with that company now to see if we can get it here in the United States. In the meantime, I found some lactoferrin from Australia, and that's already in the IC Network shop. I only got 12 bottles of it, and one bottle has sold. Um, so you would have to go to the IC Network shop and search for lactoferrin. So anyway, that's so, in the old days of supplements, the assumption was you'll have a bladder disease. Everybody has an incurable bladder disease, and we have to focus on the bladder. But that we're not there anymore. We're not focusing entirely on the bladder now. Now we're focusing on nerves. Now we're focusing on other things and really respecting the fact that we're all very, very individual. And what works for one person might not work for another, and vice versa. Laura says, "Oh my God, I've been having recurring UTI for the past 2 years. Never had issues till perimenopause." Laura, but that's exactly why you're having recurring UTIs. Think about how your bladder defends itself. So the bladder is the only organ in the human body designed to hold toxic waste because urine is body waste, right? Urine contains ammonia and urea. So how can the bladder hold ammonia for hours and hours at a time and not get damaged? It's a real evolutionary marvel because the way the bladder protects itself is with a really thick coating of mucus. It's called the gag layer. So there are kind of three distinct levels in the bladder wall. This blue layer, of course, your mucus is not blue. This is just for instructional purposes. That top layer is a mucosal layer, which acts as a barrier. It keeps bacteria away from the skin. And then, of course, underneath that, we've got the urothelial cells. We call these umbrella cells. And these are the cells that protect the blood vessels and nerves underneath it. But what happens when we lose the gag layer? When we lose the gag layer, the particulates in your urine that are irritating and the bacteria in your urine that are irritating, they hit the cells where they can infect the cells. So mucosal production is estrogen dependent. So when you're young and have a lot of estrogen, you got a lot of mucus. Once you're perimenopausal, you don't have the estrogen anymore, which means you don't have the mucus so much anymore, which means your bladder's ability to defend itself is now compromised. It's just compromised. If your vulva is dry and your vagina is dry, then so is your urethra and so is your bladder. So I attended a class on recurring UTIs taught by Dr. Anthony Schaefer at the National Institutes of Health probably 10 years ago. And they've done a lot of research on patients with recurring UTIs, and they've taken urine samples every day. They've done vaginal swabs every day. They have really worked very, very hard to try to figure out why some women struggle with recurring UTIs. And here's what they found. 24 hours before the bacteria arrived in the bladder, it was found in the vagina. And it was living quite happily in the vagina. And this then led the researchers to ask, well, wait a second, what's happened to our vaginal defenses? Why has the vagina become a safe haven for bacteria? And the answer goes right back to estrogen atrophy, that the vagina is also dry, which is now allowing bacteria to infect the cells in the vagina. And so this is why if you've had 2 infections in 6 months, 3 infections in a year, you are diagnosed with what we call a complex UTI. It's not a simple UTI anymore. It's a complex UTI. And treatment is not only the correct antibiotic that will kill the pathogen they find, but also a topical estrogen to use vaginally to reinforce the health of the vagina, to make the vagina stronger and able to defend itself against bacteria. So I hope that that makes sense. Um, Now, another thing that sometimes happens in some patients who struggle with recurring UTI is that they might develop a autoimmune disorder. There's a condition called CVID. It's not COVID, it's CVID, and it's an age-related immune disorder that basically causes the IgG levels, the immunoglobulin G, to diminish greatly. And IgG plays a really important role in your body's ability to fight infection. And now I've worked with a couple of IC patients who went on to discover that they actually were showing signs of this CVID condition. And if that's the case, the treatment is getting IgG infusions that when you give the body IgGs, it can start fighting some of these infections again. So hold on a sec. Denise says, I woke up with my fourth UTI since May. So frustrating. I hope it doesn't cause horrible pain. Well, remember, so Denise, you have to remember that the only way the bladder can tell you that there's a problem is by giving you the symptoms of frequency, urgency, pressure, pain. And those are the symptoms you associate with infection, but that doesn't mean you really have infection because you can get those exact same symptoms from very tight pelvic floor muscles or from a chemical irritation of the bladder, like chemocystitis. So don't assume when you wake up and you're flaring that it's a UTI. It might not be. And the fundamental danger of assuming that it's a UTI is if you take antibiotics, if you're self-medicating with antibiotics, you're destroying the good bacteria that can keep the bad bacteria in check. And this then allows the bad bacteria and the fungus to proliferate. So we don't want to self-medicate with antibiotics or ask for antibiotics until they have proven that you have an infection. Otherwise, you're doing damage to your biome. Now, there are some patients out there who are like, Jill, it's an infection. Shut up. It's an infection. I don't want to hear about this other stuff. I know my body. I have a freaking infection. The problem is they keep saying that to their doctor over every time they flare. Hey, doc, I got an infection. Can I get antibiotics? Hey, doc, I have an infection. And before you know it, that doctor has tried over a period of a year or two or three 6, 7, 8 rounds of antibiotics, but they're not working because you're still flaring. You're still flaring. And ultimately, when you do a typical urine culture, your urine's clear and you're going, but wait, I have an infection. How can my urine be clear? This makes no sense. I have an infection. Shut up. I have an infection. I want antibiotic. Now, I was working with a patient who said that. She said that. And she refused all treatment from our doctor just cut her off from antibiotics. He said, I'm not doing it anymore. Your cultures are negative. You're not getting antibiotics. And she refused every other treatment. And she called me and she was really, really angry. And my answer back to her was, oh, I can see both sides. Prove it. Do a next generation DNA urine test. Prove it. Next generation DNA urine test will find a lot more infections in a typical culture. If that comes back positive for a funky infection like Klebsiella, like Enterococcus, Micrococcus, you got the ammunition you need. You give the data to your doctor, and that justifies antibiotics. But if that next generation test comes back negative, girl, you do not have infection. You've got something else happening. Could be chemical injury of the bladder, could be estrogen atrophy, could be a fibroid tumor pushing on your bladder, could be tight pelvic floor muscles. So you cannot um, be completely invested physically, mentally, and emotionally in antibiotics. You just can't do it because the vast majority of IC patients do not have a typical infection. But are there some patients who do? Yes, just not all of us. Most of us are pelvic floor driven, not infection driven or chemo driven or whatever. Heather says, can you talk about COVID bladder? I'm experiencing this at the moment. It's one of the worst flares I've ever had, throwing everything at it. Okay. Heather, number one, I'm so sorry. You're not the only one. We've been doing a COVID IC study for 4 years now. And so the challenge with COVID is it causes what we call a cytokine storm. It causes this massive inflammatory reaction throughout the body, and that process damages tissue. The cytokine storm is most notorious in the lungs, especially in the early days, the early rounds of COVID. The cytokine storm was deadly. So markers of that same cytokine storm has been found in the urinary tract, in urine, and in the bladder wall. So what our study shows is that 75% of IC patients who get COVID report a flare. We do. We get flares. But for 25%, it's a very, very severe flare. And I was working with a COVID cystitis patient maybe 10 days ago who was really struggling. So the good news here, and this is supported in the research with COVID cystitis, is that it is short term. It is so this is not for the rest of your life. That inflammation tends to wear down as long as you don't keep getting COVID. So Heather, you of everybody out there, I mean, listen, COVID is raging right now. I was at the store yesterday, and I was honestly shocked by the number of people wearing masks again. I mean, I'm going to say 25-30% of the customers that I saw were all masking up again, because here in California, COVID is raging right now. Absolutely raging. And when two nurses walked in wearing masks, I was walking to the store unmasked. They walked in front of me with their masks. I went, okay, we got to take care again. So it's very important that you not allow yourself to get COVID again. So I think you need to mask up to really protect your whole body. I got COVID last January, and I will tell you, it didn't affect my bladder. It affected my heart. And I have arrhythmias from it. I have tachycardia from it. 8 months later, I still have tachycardia from it. Every now and then, my heart races. So we got to protect ourselves. Number two, diet is everything for you right now. You got to do everything you can to protect your bladder, because your bladder is irritated and inflamed. So this is time for you to buckle down and be on that IC diet. Try to get as clean as you can with your diet. Simple, fresh, healthy food. You make sure you're eating your proteins. Make sure you're eating a lot of fresh veg, a lot of fresh fruit. Stay away from sugars, because sugars promote inflammation. And heat, using heating pads might help. Using heating pads on your pelvis might help. Some people do better with heat. Other people do better with ice. Usually it's heat that's helpful. When you're in pain, your muscles get tight. Heat will help relax that. So that's a very important thing that you can do. Keep your urine you don't have to drink a massive amount of water. Just keep your urine dilute. Do your good 6 glasses of water a day. You might find PEA helpful, Peora, because that might help calm some of those nerves down. And you might find lactoferrin helpful. There were, I don't remember the specifics, so don't quote me, but I do believe that there were some lactoferrin viral studies also. So lactoferrin might be interesting to try, but you want to do a lot, read about it first. So Anne says, if your UTIs come back negative, is this IC? IC doesn't mean anything, honey. IC means you have frequency, urgency, pressure, pain for which the doctor doesn't know why. IC is what we call a grab bag diagnosis. But it really doesn't mean anything. And we're not going to be using the name interstitial cystitis much longer. Most of the world doesn't use that name anymore. They call it bladder pain syndrome, because it is a pain syndrome for which there are many potential causes. So if your UTIs come back negative, what does that mean? That means that there's no obvious pathogen in your urine that's causing an infection. So if you're struggling with those symptoms, we have to figure out why. You can have a next generation DNA test to look for something else, but we want you to get your pelvic floor muscles checked. Let's see if you got tight muscles, because tight muscles can cause frequency, urgency, pressure, pain, along with other things. Hi, Kayleen. As Shelley says, what about bladder spasms? Now, bladder spasms are interesting, and you guys are having a big discussion here on YouTube, and I haven't read through it yet, so bear with me if you're asking questions. Gotta feel free to, you guys, be the squeaky wheel, ask your question over and over until I catch it because it goes fast. So, bladder spasms are wicked. They're just wicked. Uh, uh, um, you have to understand that the bladder itself is composed of what we call smooth muscle. So, smooth muscle is not muscle that helps your body move. Smooth muscle is the muscle that expands and contracts to help your bladder function. Skeletal muscle, your pelvic floor, is a completely different type of muscle. It's called skeletal muscle or striated muscle. Skeletal muscle is muscle that helps you move your body. So we've got skeletal muscle, we've got smooth muscle. So you can have a bladder spasm or you can have a pelvic floor spasm. So bladder spasms usually start at the last couple of drops of urine leave your bladder. And and at least in my experience, the one time I had very, very severe bladder spasms, and I did not know what they were. It turned out that what I thought was a flare for 6 weeks was actually a really bad bladder infection. And at the end of that infection, I had terrible bladder spasm. I dreaded peeing because I knew as the last couple of drops came out, I would be bent over on the toilet with this agonizing spasm. And it would take a couple of minutes for it to go away. And the pain would shoot up my back and down my legs. It was just absolutely terrible. So, medications like ditropan, oxybutynin are smooth muscle antispasmodics. And that's what my doctor gave me, the little blue pill. And within 20 minutes, the spasm goes away. So it's a muscle relaxant for smooth muscle. Now, a pelvic floor spasm is different. Pelvic floor spasms, gosh, how would you describe a pelvic floor spasm? A pulling sensation, a pushing sensation, burning, uh, difficulty starting urination because your muscles are so tight. Um, um, when you think about when is your pain the worst? Before you pee or after you're done peeing? Pelvic floor pain is worse after you're done peeing. So if you're having a really sharp pain after urination, that could be a sign, not during urination like the bladder spasm, but afterwards, that you're having some pelvic floor spasms. And in that case, you want to do a skeletal muscle relaxant like Flexeril or Baclofen. And Kayleen here on Facebook said that bladder installations help her bladder wall spasms. Our big challenge with oxybutynin and that class of medications is they're anticholinergics and they're linked to dementia and cognitive decline. So if you take them every day for 3 years, there's a significant risk of dementia. So instead of doing those typical overactive bladder meds, antispasmodics, they're using a medication now called mirabegron or Myrbetriq, which can help frequency urgency without the anticholinergic effects that lead to dementia. All right, let's go. Let me see what you guys are saying here on YouTube. And I apologize, Guy. Okay. So hold on a sec. Nicole said, "Have there been any studies on Peora?" No, but there have been studies. There are tons of studies with PEA. Tons of very good studies with PEA. Surgical pain, chronic pain, acute pain, shingles, burning mouth syndrome. There are so many studies out there. You can go to PubMed.gov. the National Library of Medicine and search for them. They're amazing. Karen says pre-leaf doesn't help. Well, remember, pre-leaf doesn't do anything on your bladder. All it does is reduce acid levels. So if you're taking pre-leaf because you think it's going to help your frequency or urgency, you don't understand the med or the supplement because it's not targeting the bladder at all. It's targeting the acid in the food. So all it's going to do is prevent food-related acid irritation. And that's one reason why it's so popular. Laura says she loves pre-leaf. She was in remission for 12 years thanks to quercetin. Sadly, a recent 1-month-long UTI has given you some issues again. Yep. Yeah, because your bladder wall is infected again or was infected. And, our challenge here is that infections are damaging. When a bacteria infects a cell, so let's look at it here. So let's just pretend these gold stars are bacteria. So look, so it's now gone into the cell. It turns the cell into a bacteria factory. So this cell is going to rupture open hours later with hundreds and hundreds of new bacteria. They're then going to affect this cell, and this cell. So now we've got these cells infected. They're going to turn in bacteria factories, and now the cells underneath them are going to get infected. So infections basically cause a tunneling effect in the bladder wall. They do a lot of damage to the bladder wall, and it takes time for these to repair. These are the largest single cells in the human body. They don't repair overnight. It takes 2 weeks for one of these cells to be replaced. So there can be a long recovery period from having a severe bladder infection. You have to be patient, protect your bladder, no coffee, no cranberry, no soda. Ask yourself, what would you pour on a wound on your hand? And that's what you want to pour on a wound in your bladder. And that's going to be water or milk or chamomile herbal tea or peppermint herbal tea. Okay, hold on here. Okay. I love Nicole. She says she's a redhead and sensitive to med. I love being a redhead. I love being a redhead because I am now getting revenge over all the kids that teased me when I were young, and they're now gray. And I still have red hair. But the challenge with redheads is that we actually have statistically more nerves in our body, like 20% more nerves quantitatively than other people. And so it's much easier for us to have more nerve related issues. It's harder to do surgery, harder to have dental work. They usually have to use a lot more anesthetic on us. Nicole says she loves the PEA, works immediately. One of the ways that you can differentiate between a bladder wall flare and a pelvic floor flare is by how you're peeing. That's how I can tell when my muscles are starting to get funky. So if you can sit on the toilet or stand in front of the toilet and literally pee like a horse immediately, you're good. Your muscles are good. But if it takes time for you to relax enough to release urine and you're stopping and starting and stopping and starting, that's a sign that we've got some muscle stuff going on. Hold on. There's a lot of stuff going on over here on YouTube. Eddie says there are also studies on the benefits of lactoferrin for long COVID. She says, but I don't think it would help me as I'm allergic to cow's milk and it can increase my histamine level. It might. Denise also has lichen sclerosis. Lichen sclerosis, um, Rebecca, it's Peora, Peaora. This is the one that I take. This is the first one that was created specifically for our market, at my request, as a matter of fact. I took the company, the IC study, and this is what they made. So Peora. And you can find this in the IC Network shop. All right, hold on a sec. Let me just make sure. Denise was tested positive for COVID this morning. Laura D said, my last UTI came from a normal bacteria in our gut, thanks to COVID giving me a week of diarrhea. Yeah, this new round of COVID might not have the lung issues, but there are a lot of patients struggling with a lot of diarrhea. Denise said she's always getting Klebsiella. Denise, if your infections always come back Klebsiella, then you have a drug-resistant Klebsiella or a source of Klebsiella in your daily life that keeps reinfecting you. And you, I think, would really benefit from a next generation DNA urine test where they can identify antibiotic resistance genes and they will be able to tell you how to correctly treat it. Drug resistant genes are not identified in a typical urine culture. It takes a DNA test to do that. Denise says, my IC, I always have bladder pain. UTI pain is when urinating. Okay. So, for anybody out there, let's just say that you've got symptoms constantly. No matter what you do, you have symptoms constantly. You need to be phenotyped. You need to be phenotyped. We need to figure that out. And we don't want to just chase the symptoms. We want to find the underlying problem. What is the underlying problem? And when we find the underlying problem with phenotyping, um, then we can do the correct treatments for your unique case. Okay, so hold on a sec. Getting back here to Facebook. Hold on a sec. Karen says, thank you for your help last Sunday. My alpha flare has subsided. Yeah, baby. My doctor has put me on compounded estriol and it's helped. Yes, excellent. Mary asked, when hunters or lesions are treated, do they come back? Some do, some don't. That's why they have to check. Let's see. Karen said she's taking bovine colostrum, and I think it's helping. I was never a colostrum fan because we just didn't have any research backing it up. It didn't make sense to me. But with this new lactoferrin research, uh, my opinion is swing. Karen says she likes oral Valium. Karen, all Valium is a skeletal muscle relaxant. And so if oral Valium works for you, what that's doing is it's relaxing your pelvic floor muscles. You just have to remember that Valium can be addictive. And so this is not something you want to be doing every day. If you're having muscle problems, you need to be in physical therapy. Valium will never fix a dysfunctional muscle. It will just cover the symptom of the dysfunctional muscle. What we need to do is figure out why that muscle is tight and spasming. And so it's very important that you be working with a properly trained pelvic floor physical therapist. Marlia says, Brenda says she's taking Manjaro 2 years ago for weight loss. I don't know what that is, hon. Send me info. Marlia says, what do you think about the least irritating lubes are? Is good, clean love a possibility? Slippery stuff? Yeah, whatever works for you. Even coconut oil. And she just started using V Magic and yes, good. It'll be interesting to see how you do. Kayleen says, "Isn't PGAD affects pretty much pelvic floor spasms?" A pelvic floor spasm would absolutely make PGAD worse. So, PGAD is what we call persistent genital arousal disorder. These are patients who are struggling with sudden, unexpected, unprovoked sensations of arousal, sometimes very, very painful arousal. You could be driving your car somewhere, and all of a sudden, you've got this really patients have described it in a lot of different ways: disgusting, annoying, frustrating, agonizing. But to be in the middle of a workday and suddenly have an orgasm or feel like you're going to have an orgasm is what I call one of the dirty secrets that patients don't tell their doctors about. But it's actually, I'm not going to say common, but it's certainly been found in a number of patients who have pelvic floor dysfunction. And so PGAD occurs when a pelvic floor muscle tightens over the pudendal nerve. So I had PGAD for about 6 weeks, a couple of years after my IC started. And of course, it made no sense to me. We didn't even know about the muscles back then. So it's like, okay, why do I have that? Um, and then it went away as I think my muscles got better. And I haven't had it since, but I know it's awful when it happens. So if you're having persistent PGAD, then we know we've got a very tight muscle. If you're having a pelvic floor spasm and that muscle is squeezing that nerve, that is going to be a sudden agonizing moment of PGAD. Yes. And so hopefully your physical therapist has identified the muscle that's dysfunctional and they've given you some exercises and stretches that you can do that can release that muscle and reduce that pressure on that nerve. Shelly says, bladder fiery, does it help? I've never heard of that, Shelly. What is it? Bladder fiery? Is that a supplement? Never heard of it. Debbie says, it takes so much time to pee. I've learned to stand up when I think I'm done and then sit down and void some more. Debbie, that's very common after menopause. I call it milking your bladder. I do exactly the same thing. It started for me in my early 50s. And the way my doctor explained that is the loss of estrogen also ends up weakening some of the muscles down there. And that's what kind of causes the incomplete emptying, or like you think you're empty and then you stand up to put your underwear on and it's like, nope, gotta go some more. You sit back down some more, get a little bit of more urine coming out. And what I've noticed more, I'm 64 now, is that I will have moments when I really genuinely feel like I'm completely empty. And then like 30 seconds later, in fact, it just happened this weekend. I felt like I needed to go to the bathroom again, and a lot of urine came out. And my pelvic floor is not particularly happy with me right now because I've been sitting a lot. Because I had to kick off IC Awareness Month. And guys, we have a ginormous email newsletter, and 35,000 patients get it. I send out this newsletter once every 2 months, maybe. And I did a massive one last week, one of my biggest ones ever. And a lot of people say e-newsletters are old school. People don't want e-newsletters anymore. But it's where I do my best work in letting you know all the new stuff that's happening. And it's free. So if you want to get and it's, I don't sell that list. I've never sold that list to any company. And believe me, every single company is asked to buy that list. And I say, no, no, it's my list. And I don't I use it to send out newsletters. I use it to send out clinical trial blasts. I will be sending out a clinical trial blast probably on Tuesday or Wednesday. And I'm very respectful because we're all frankly very, very sick of spam. I am too, especially political spam. Okay, hold on a sec. Does PEA have dairy? Not that I know. I don't believe it does. Hold on. Let's see if there is a naturally formulated without wheat, soy, milk, shark, fish, shellfish, or tree nuts. So there is no milk in Pura. Laura says she can't find PEA in the ICN shop. Honey, it's right on the front page. You're not on the right page. Just go to icnetwork.org and the shop. There's a link in the upper right hand corner, that right side of the menu. Just go into there, and it's right on the front page. It's one of our biggest sellers now. Okay, Be Kind said she had an InterStim phase 1 installed last Friday, and my overactive bladder is 87% better. I can now tell the difference between urge and IC urgency. And you take magnesium at bed that helps. You're having your final implant on Friday. Honey, good luck to you. Good luck to you with your final implant. You want to make sure. So I've talked about this many times. Be Kind over the years, because I ran the Northern California IC group when InterStim was developed, and I've worked with InterStim patients literally from the time that it was launched. Um, there's a big difference between the trial and the final implant, because when you have the final implant, that's when adverse events have the potential of occurring. So, as an example, um, deep tissue MRSA infection. Um, because they implant the generator on your buttock, your upper buttock, but there's a lot of bacteria on that skin, anyway, regardless of what they do. So infections post implant are actually fairly common. And if you go to the National Library, no, if you go to the MOD database with the FDA, and I'd be happy to show you that database, and we can go through it so you can see for yourself the type of adverse events that are being filed about InterStim after the final implant. And unfortunately, there are a bunch. So the reason why I say that to you is because I want you to be educated and informed, but most of all, I want you to be very assertive and proactive if you have issues after they do the implant. You know what? Let's just do that. So, InterStim is neuromodulation. Neuromodulation is about kind of re-regulating dysfunctional nerves. And so, again, now that we're phenotyping, they're kind of refining who would be the best candidate for neuromodulation. So, doesn't quite make sense for Hunner's lesions or estrogen atrophy. Might help. Hold on, I just heard something, and I'm alone in the house. Hold on. If you hear me scream, call the doctor. I mean, call the police, but let me just check real quick. Okay, it's okay. I'm okay. I'm okay. I'm okay. The wind was making a door move. Oh, dear God. Okay, so anyway, let's go to the National Library of Medicine. I'm just going to go. Okay, this is very important for people to understand. Um, InterStim, when it was developed, was kind of marketed with a Darth Vader approach. That's the way I described it. And that is the the subtle message that was given to doctors was, "Hey man, you know those patients who keep calling you and annoying you because they're flaring all the time? You can get rid of them if you do this implant." So this was like, wow, I was a big bird. Like 15, 20 years ago, like right in the earliest of day. Yeah, 20 years ago. No, longer than that. Maybe 28 years ago. And it was very disappointing as a support group leader to kind of see patients kind of pushed to the side. Hey, give them the surgery, you're done with them. But InterStim requires a lot of maintenance. Now, listen, it can be life changing for patients who are incontinent. InterStim was approved specifically for urinary and fecal incontinence. There is an absolute place for InterStim. I do not hate InterStim at all. It can change the life of somebody tremendously for the better. It's just something you have to be aware of. You have to understand that it is associated with more risks. Number 2, it can be incredibly expensive. And number 3, it can require multiple surgeries, And so it's not just one surgery, you're one and done. It's 2 surgeries. You got the trial, then you got the final, and then the final might work for a while, but then you might have to have a revision surgery. And then if the device doesn't work, you have to have another surgery to have it removed. And one of the things that really pisses me off is that there are some patients whose device does not work and they have it turned off and they want it removed, but their health insurance will not authorize its removal unless it is malfunctioning. And that's something I really disagree with because it doesn't belong in the human body if it's not working. And that's anyway. So let's go to the mod FDA database here, and let's just go through like the first 10. And let's just see what the FDA has gotten recently. I mean, because there are a lot. There are a lot of them. I mean, hundreds a month. Okay, so I'm just going to search in July. I'm just searching brand name InterStim, July 1st to July 30th. Okay, let me make sure I got, okay, July 1st, 2024 to July 31st, 2024. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There are at least 10 pages, each with 10 reports. So that's over 100 filed in the month of July. So let's just look at the first one. Information was received. So this is an injury report. Information was received from multiple sources, including the manufacturer's representative and the healthcare provider, regarding a patient who was implanted with a neurostimulator for unknown indications. It was reported that the patient arrived at the hospital in pain at the pocket area, which is where the generator is implanted. There were signs of infection. It was decided that the device should be explanted. The healthcare professional removed the device and the lead. Antibiotics were given. There you go. A perfect example. We have seen hundreds and hundreds and hundreds of these reports. One of our challenges here, I can still remember a patient I worked with years ago who she did really, really well on the trial, really, really well. But she knew as soon as she woke up from the implant that there was a problem. And they wouldn't listen to her. And she kept saying, guys, it doesn't feel the same. It hurts. Weeks passed, months passed. And she's literally crying in pain from this surgery. And when they finally opened her up, her belly was filled with rusty battery fluid. The device had broken when they implanted it. And she had gangrene. And the flaw in that is that the doctor didn't listen to her. They kept saying, "Oh, you just had surgery. It takes time to heal. You gotta wait a week. You gotta wait a couple of weeks or a couple of months." You can't do that. If something feels really, really off, you have to go back to that doctor and say, "Look at this. This didn't happen before. There's a problem. I need you to understand what this problem is." Because if they had taken her seriously, she would not have ended up with gangrene. And that's one reason why I'm very, very determined to make sure that every patient who has a medical device, if they have a problem, they need to file with the FDA what happened because this has to be tracked. This needs to be tracked. All right, so that's the first one. Let's look at the second one. Malfunction. Ooh, damn. Okay. This was okay. Additional information was received from the patient. They called to inquire about the compatibility for a bone density test later today and reported they hadn't used the device in several months. Patient guessed it had been 18 months or so because the therapy wasn't working for their symptoms. Patient stated they were always falling and they met with the manufacturer's representative at their follow-up appointment probably 18 months ago, and the rep had told the patient they'd knocked the wires from their sacrum when they fell, and that's why it wasn't working. Patient services asked the patient when the therapy stopped helping her symptoms that led to the rep determining that the lead had been knocked loose, and the patient said it never really did help their symptoms and that they were always changing the programs. Patient could not recall the name of the rep who they had met at the healthcare provider office, and the patient reason for a call had been to inquire about the bone density test they were going to have. Um, Patient services reviewed compatibility with the patient and redirected the patient to have the provider uh, performing the bone scan to call Medtronic and to document any reported event. Okay, that's just the second one. Let's go to the third one. Injury. Information was received from a patient who was implanted with an implantable neurostimulator for urinary dysfunction, sacral nerve stem, and pelvic floor. It was reported that a few months ago, I had an appointment with a healthcare provider, and Medtronic representative came to the hospital and said it wasn't working and turned the implant off permanently after reviewing previous calls. Patient said that it had actually been a couple of years since the implant was turned off and a couple of months since the patient called about the issue. When asked, the patient said the implant is no longer functional and she has to wear a catheter 24 hours a day, 7 days a week. Patient said that each time they went to the doctor's office, they had an adjustment made by Courtney, the nurse practitioner, and they couldn't increase the setting any higher. Based on the information provided by the patient, the insured battery status is unknown. The patient asked for assistance in getting an MRI, reviewed MRI information and options to consider having the implanted batteries checked and potentially having the managing doctor fill out an MRI eligibility form. Okay, that's just 3 of 100 that have been filed just this month. Yeah, okay. So be kind. If you search for MAUDA, MAUDA, like the old TV show, a lot of you are too young to remember that. The MAUDA database, FDA, and that will take you to the searchable database. You just put in InterStim as the brand name, look at the dates. You can go back years. You can look at the last month, you can look at the last year, and you go through these. You have to go through these so that you really understand and can put context to any weird things that happen. There is another form of neuromodulation called um, uh, percutaneous tibial nerve stimulation. It was also created, so InterStim was created at UC San Francisco by Dr. Chinago and another doctor. Well, there's another doctor at UCSF named Dr. Stoller, Marshall Stoller. He was stunned and somewhat appalled by the pain that people were experiencing when they were doing InterStim because back then they weren't using anesthesia to do the trial. So patients were literally screaming bloody murder as they were putting implants in without pain meds. And he said, guys, you don't have to hit the nerve at the sacrum. You can hit the exact same nerve at the ankle. And you don't have to cut anybody open. You can use an acupuncture needle as a vector to the nerve. Attach your TENS unit to the acupuncture needle above the ankle. You will hit exactly the same nerve bundle. And he proved it. And so this ankle stimulation known as urgent PC is much less traumatic than InterStim, requires no surgery, and has virtually nil adverse events, whereas the surgical neuromodulation has hundreds and hundreds and hundreds of severe adverse events filed. So when I went to UCSF, I was thankfully put into the ankle stim group. I would have done InterStim back then because I was desperate, and I praise God that I ended up in Dr. Soller's hands because the ankle stim worked for me. By the third treatment, I had my first 2 hours without pain, and by my seventh treatment, I had my first day without pain. So anyway, and then I started my support group like 2 months after that, and then I started seeing all the InterStim patients going, "Oh, holy hell, did I escape?" Because those early days were terrible. InterStim today is much, much better. It's much more refined, but it still has a lot of adverse events. Kay says, glad to see you in fine form today, lovely lady. Thank you, hun. I feel pretty good. My incisions are, so like I'm wearing my butterfly shirt. But if I turn to the side, they're gone. The bosoms are gone. I had ductal carcinoma in situ stage 0, which means I didn't have tumors. I had the pre-tumors, calcifications. They were confirmed cancer in 2 needle biopsies. And because I had 100 of them along the length of a milk duct, I wasn't eligible for a lumpectomy because there was just too many of them. And so my only treatment on the left side would have been a radical mastectomy or a mastectomy. And I just said, I'll take them both. I don't need breasts anymore. I'm 64. They've annoyed me for years anyway. So it was a really easy decision for me to make to have a mastectomy. I did not understand how difficult the recovery would be. I mean, I have incisions from the middle of my armpit all the way across my chest to my other armpit. There's only a 1-inch gap in the middle. And there are hundreds of sutures. They glued the incision together, but there are hundreds of sutures still there right now. And if I move the wrong way, I feel them. I will be at 2 months next week. And the pain has been very, very persistent. So I asked my doctor, I said, why me? This is fascinating. Like, we have no breast cancer in my family. We have no estrogen-driven cancers in my family. I've now had 2 because I had the preuterine cancer and now I had the early breast cancer. Why me? There's nothing in our family. There's no genetics in our family that suggests this. And what she said is, well, only 15% of breast cancer patients are genetic. For the rest of you, it's environmental, that we're exposed to carcinogens in our daily life in some way. And of course, all it takes is anti-flammability chemicals put in sofas. Those are well-known carcinogens. We've all been exposed to those for years. Throw in plastics. Anyway, and remember, I've got a couple of degrees in chemistry, and I was exposed to formaldehyde and all sorts of stuff like that. And so a lot of formaldehyde and a lot of benzene. So, okay, I've had my hands on carcinogens for sure. But or periods of intense stress or grief. And 2 years ago when I had my mammogram, I had nothing. Calcifications look like little sparklers. On a mammogram, they're a very bright pinpoint of light. So 2 years ago, nothing found in my breath. A year ago, but what was happening is I was caring for my elderly parents the last year of their life in the middle of a complex fire season where we had to evacuate, and then they died. And the grief was, you guys know this, for those of you who followed me, I was a mess a year ago. A year ago, September 1st, I was still crying every day. Interestingly, there was a doctor who just there's a doctor on YouTube who was just talking about the 3 things that grief can cause can do to your body. And the last one was it can make cancer grow. And I was talking with a patient like a like a like 3 weeks ago whose daughter had just been diagnosed with breast cancer. In fact, she should have had her her surgery, double mastectomy a week ago. And for her, she had been in a very, very agonizingly stressful divorce for a year. And then she got breast cancer. So anyway, one of the lead stories in my magazine, The Icy Optimist, which is almost done. It's at the typesetter. We'll do the final edit tomorrow or Tuesday. Is the role that stress plays in the onset and growth of cancer. And the research is undeniable. They've proven it. The periods of intense stress, periods of intense grief causes cancer to grow and metastasize because of the sheer trauma that happens to the human body when you are under such intense stress. So I go through all the research with that. And so my goal now is to try to de-stress as much as I possibly can. Like I'm working at it now. I'm trying to work at it now. And when I can counter things that begin to stress me, I step away because my health is too important. I don't need to fight with somebody about something that has no role in my life. Even if I'm with friends, if if there's a disagreement that I'm starting to feel a little stressed about, I just walk away. It's okay. I'll come back. So it's really the biggest message for me really is how important it is that we de-stress and that we get off of the internet and get out in nature and just let nature heal. So anyway, okay. And if anybody wants to see the incisions, I'm perfectly happy to show. I've already showed them in my breast cancer vlog. I'm happy to show the incisions if you want to see them. You just have to ask. All right. Denise says the compounded estradiol was irritating me so bad. My gynecologist told me to try Reverie, and it's a world of difference with dryness, but it's expensive. It's not a prescription. Okay. And Manjaro medication is a medication for diabetes. Thank you, Kayleen. Kate says she loves getting our newsletter. Rebecca, how can you get the newsletter? Just go onto the IC Network website and sign up. There'll be a pop-up window. Mary says, I've tried to get the newsletters with no success. Mary, I think we've talked about this on the phone. Pretty sure your email is in the newsletter, but it's your mail program that's probably sorting it out. All you have to do is call me and I'm happy to send it to you separately. Just give me I always like talking to you. Just give me a phone call. Gay said, I have got an axonic neurostimulator axonic neurostimulator implant. And I've had great success with it. Good. Much fewer adverse events with axonic. Denise says, I look amazing. Thank you, honey. I can put a brave face on it and then I'll be crying for a couple of hours. Not so much. I was with a friend on Friday who came over and she's like, "You look so good." And I said, "Yeah, I'll be good until about 4 o'clock. And then all my incisions start to hurt. And oh, that night was really bad. And I was crying for a little bit." Okay, hold on a sec. Uh, so hold on. Laura says, "Is there a good colostrum that doesn't cause issues for people with dairy issues?" I don't know, hun, because I've never sold colostrum. I'm going to look at it now, though, probably. Um, Denise says, "Sometimes I get horrible vulva burning with a flare or a UTI. My clitoris actually hurts and throbs. It's awful, but so far not this time." Okay, so if your clitoris is hurting during a flare, that's not from your bladder, that's from your pelvic floor squeezing the nerve, your pudendal nerve. So you're having a pelvic floor flare. When that happens, that means your pelvic floor has gotten very, very tight. So you need to do things that will relax your pelvic floor. We have, you guys, if you sign up for our newsletter on our website, the gift we give to you is our I think 40-page flare management guide, which talks about the different types of flares and their hour by hour rescue plans. And I need to redo so much. I want to go in and edit everything, but when sitting at the computer hurts, it's hard. But anyway, it's a great guide. Hour by hour rescue plan will help you differentiate between a bladder wall flare and a pelvic floor flare and a stress flare and a hormone flare. All right. Be Kind says she slept 5 hours straight with your stim. It's the first time I've slept longer than 2 hours in 4 years. Awesome. Be Kind said PTNS has to be done in the office for 20 weeks straight with no breaks and can't be done at home. Be Kind, that is not the way, that was not the protocol that Dr. Stoller created. Dr. Stoller did 10 weeks and then he taught us how to do it at home. I have the tattoos. Let's see. Hold on. You see that little black spot right there? That's the tattoo they gave me to tell me where to put the needle in, the acupuncture needle in. So I did it at home for a year. It's super easy to do it at home. It just means that they don't. Well, I don't want to say something improper, but anyway, it might be more visible on this side. It's right there. See that little black spot? I think it's about control, I guess. William, hello, William. Dude, how are you? Hunter's still ruling my life. I decided to no longer get the fulguration. I've had the operation six times. Last March was my last one. Since then, you're getting progressively worse. Hyperbaric oxygen still not covered by insurance due to it being experimental. William, number one, dude, you have got to be the squeaky wheel. We've got the research that shows that it helps. I can give you that research study. You can give that to the health insurance company and say, listen, you've had to pay for 6 surgeries for me so far, and they haven't worked. But we've got another way of tackling this that might work, that could save you money in the long run as my health insurance company. Why don't we give the hyperbaric oxygen a try? But, William, so you came in later. Interestingly, I've got something else you might want to consider trying. This was a paper that was published last month on lactoferrin. You're trying to be squeaky good. Just Be bold, my friend, and mighty forces shall come to thy aid. Lactoferrin is basically the most important immune protection that is found in colostrum given to babies. So, when a baby is born, it's very important that they get some mother's milk early on because that helps to build their immune system. And it's the lactoferrin that helps to build the immune system. Um, but it turns out that lactoferrin has also been remarkably successful for adults who are struggling with a variety of medical conditions. And last year, this research team in Italy were able to prove that lactoferrin helped to prevent and reduce recurring UTIs. It's also been tested, as somebody pointed out, with long COVID. There are a lot of studies with lactoferrin at the National Library of Medicine, if I remember correctly. Anyway, I was given this paper like a week after I had surgery, and so I've been sitting on this paper. I haven't done all of my due diligence reading about, but I've done quite a bit of reading, but not quite enough. But I want to read you this paper. So this Italian team decided to try lactoferrin on IC patients. He took 31 patients who had a history of interstitial cystitis symptoms, had been diagnosed with IC, and a history of flares. Okay, out of those 31, 28 had no flares while they were taking lactoferrin, and 3 had one flare. Just one flare during the follow-up after treatment. Lactoferrin basically acts to, let's see, it's complex what lactoferrin does. No side effects, comes from cow, bovine lactoferrin. So hold on a sec. Oh, it's a complex explanation. Lactoferrin is a multifunctional iron-binding glycoprotein of the innate immune system, consistently synthesized by exocrine glands and neutrophils. It is present in all secretory fluids like your tears, and its highest concentrations are found in colostrum and milk. Lactoferrin can scavenge free iron in fluids and in inflamed and infected sites, helping to suppress free radical mediated damage and reducing iron availability to pathogens. Pathogens need iron to grow. Further, the broad spectrum of functions exerted by lactoferrin is closely, it's complex. Okay, it just talks about how it sticks to skin. Bovine lactoferrin exerts a potent anti-inflammatory activity due to its ability to enter the host cell nucleus, where it is able to interact with specific DNA sequences coding for pro-inflammatory cytokines. In other words, if you can stop the cytokines, the inflammation goes down. So here's the thing. On cystoscopy, after lactoferrin therapy, the bladder wall was less reddened, less inflamed, and Hunner's lesions reduced dramatically. And if I can get the quote here. So this is the paper. It was published in a journal called Biochemistry and Cell Biology. So there was a reduction in suprapubic pain, urinary frequency, and urgency before and during treatment. All patients had recurring flares during the 6 months preceding the study. 10 episodes in one patient, 7 to 8 episodes in 4, 5 to 6 in 20, and 3 to 4 episodes in 6. Following 17 weeks of Valpath treatment, all patients underwent a follow-up visit at 16 weeks. At the end of follow-up, there was a marked reduction of flares in the whole study sample. 28 patients did not manifest a single flare, whereas 3 had one. Treatment reduced, there was a significant decrease in serum levels of interleukin 6, which is a sign of inflammation. It was safe. It did not induce any side effects because it is a natural part of the human body. And the bladder patients before treatment, okay. So every patient in the study had a cystoscopy. And then they compared the appearance of the bladder before versus after. William, I actually have it in my shop now. I only got 12 bottles. But let me just read you this. So before treatment, their bladder showed inflammation by tiny vessels, as well as the presence of Hunner's lesions. After treatment, the bladder showed a decreased inflammation. It had a lighter color, and the Hunner's lesions appeared to have almost completely disappeared. So the specific medication they used, which was a combination of lactobacillin and lactoferrin and a little bit of sodium bicarb and calcium citrate, it's called Valpath, is available in Europe. It's not available in the US. But I brought in, as soon as I got the study, I brought in some lactoferrin from Australia, and it's in the IC Network shop. It is a little bit more expensive, but I'll say, wait a second. Wait, hold on a sec. Where is it? I'm going to send you a free bottle if you want to try it. Hold on. I got one sample. Hold on. Yeah. I was up at so I ordered 12 bottles. Lactoferrin 95. I will be happy to give this to you if you want to try it, because I know you have suffered. I mean, each bottle cost me like $40. So they're not cheap. So I can only give one away. But I have it in the IC Network shop. So William, if you email me or call me on Tuesday, this is yours. I will be happy to give it to you, because I know you have suffered. Y'all have suffered. I know that. Everybody has suffered out there. I'm not minimizing anybody else's. You'll cover the cost? Okay. Call me on Tuesday. Call me on Tuesday and we'll talk about it. Okay. You guys, listen, I never turn anybody away. You know that. This meeting is free. And I understand implicitly that money gets tight for people. And so all you have to do is call me. I can't necessarily give everybody free things because I will have no retirement. But I will try to do anything I can to help. Okay? Our phone number is at the top of the IC Network website. Just go to icnetwork.org. It's an 800 number. It's in the IC Network shop. It's not in the menus yet. It's not on the front page. So you have to search for lactoferrin. And this is the best company that I could find. Is that closer? Yeah, lactoferrin 95. Now, the researchers say, hey, we need more research. We do definitely need more research. This is exactly where we were at with the PEA research in 2019. But what do they say here? Antiviral, antibacterial, improves iron assimilation, regulates the immune system, promotes healthy gut bacteria. When? And given our theory, remember we've got research that's connected viral infection to Hunner's lesion. Somebody asked, why do lesions recur? Well, if you've got an active viral infection, the virus is still there. I mean, that's the challenge with a lot of virus. A lot, once you have herpes, you have herpes. And normally the virus lives silently on nerves, and then during periods of intense stress or injury, the virus gets turned on. That's why I get canker sores all the time. And so we have very direct, credible research from the US National Institutes of Health, as well as from our IC researchers in Europe, that has linked viral infection to some patients with Hunner's lesion. Specifically, the Epstein-Barr virus or the polyoma virus. We also know HPV is a beast. There are many, many different types, families of the human papillomavirus. Some are benign, some are terrible carcinogens that are giving young people urethral cancer, bladder cancer, vaginal cancer, rectal cancer. And so viral infections are tough. Denise says, where can I get my next generation DNA test? From Microgen, microgendx.com. Tell them I gave you their website if you talk to them. Does your doc do it? Your doc can do it, but some doctors they don't like it because they don't know how to interpret it, or the health insurance company doesn't want to pay for it. If the health insurance company doesn't want to pay for it, then, a microgen test is going to be about $220. Generally, you order it yourself, you pay for it yourself, then you bring the form back to your doctor and they sign it. But microgen testing is, according to conferences at the American Urology Association, the future of urine testing, because a urine culture is self-limiting. A urine culture will only identify bacteria that eat the culture. And there's no such culture that's universal. So, next generation DNA urine testing will identify 90% more bacteria than a typical urine culture will, especially the bacteria that are hard to grow. The way they do a next generation test is they take your urine sample and they beat it up and they kill everything in it and they shred it. So all they're left with are particles of molecules, various structural molecules in DNA. And then they look at the DNA, and the DNA will then tell them what's living in your bladder. Good bacteria, bad bacteria, virus, and fungus. The typical microgen test does not do viral screen, but it does a fungal screen and the bacterial screen. But all that COVID testing we've all had, man, that's all next generation testing. A lot of that's next generation testing. Hold on. Where somebody asked, Be Kind said, do I have a blank printout for a bladder diary on our website? Yes, it's in our free download area. Karen said, my grief is heavy for my son and my mom and my uncle. So you paint and it's way better. Karen, you want to see what I'm painting right now? Here, I'll go get it. My sister gave me last Christmas, because I'm a very crafty person. Like, the perfect vacation for me is just going to a craft camp. I'm not, I just like making things with my hands. I like turning hard periods of my life into something that's pretty. So here, I'll go get the one I'm working on. Hold on. How do you like that? It's the first animal one that I've done. I've done women on beaches and I've done people flying kites. I just really like pops of color. This like makes me so happy. And I think it's just because the colors are just so this is a paint by numbers, guys. It cost me 15 bucks. And it's just so fun to do and it's just like my meditation. It's just how I meditate is I just turn everything off, put on some music, put on a book on tape, and I just sit at my kitchen table and I paint for an hour or so at the end of the day. She's so pretty. I really like her. If it's a girl, I don't know if it's a girl or a boy. All right. So we have been going now for a little over 2 hours. Um, I will go as long as you have questions. The other offer I will make to you is if anybody wants to go into Zoom and talk to me face to face and I can phenotype you, I am happy to do that. We can switch this meeting over to Zoom. It's completely your choice. I know it's a Labor Day weekend, and who wants to sit in front of a computer this much on Sunday? I hope you guys have a really good day tomorrow. And I am now available for coaching again and stuff. Shelly wants to know about the bladder diet. What do you want to know about the bladder diet, hun? So, back in the early days, we certainly learned that many patients struggle with foods. The foods were known to irritate their bladder, specifically foods that are high in acid. And so that's going to be coffees, green teas, black teas, sodas. Green teas are devastating, guys. So many patients, green tea. Oh my God, they have terrible pain from it. I had one of the worst flares in my life from a cup of green tea. So, Shelley says, "Does it work?" Yeah, it absolutely does work. Absolutely does work, but it depends upon your phenotype. Okay, so if you have Hunner's lesions on your bladder, 100%, diet's everything to you because you've got open wounds. Sorry, my incisions are now pulling because it's getting late in the day. So bear with me while I rub my incision. If you have Hunner's lesions, you've got an open wound in your bladder. And pouring acid on a wound would hurt. If you had a wound on your hand and you poured soda on it, I can promise you it would hurt. The same thing happens. The same thing happens with a cup of coffee and a Hunner's lesion or a soda, Diet Coke with that. Acid on a wound hurts. With our bladder wall driven subtype, if you have estrogen atrophy and your bladder lining is thin now, and it's not capable of keeping urine away from your skin, you too are going to be very, very diet sensitive because that acid is now going to get through directly onto the cells of the bladder and cause pain. If you have a chemical injury of your bladder, if you're in the chemocystitis phenotype, you also have the injury here, which means that you also have to follow the diet. Now, if in contrast you're pelvic floor driven and your symptoms are being caused by tight muscles, you're going to be less diet sensitive. But you can still be diet sensitive because your bladder wall isn't getting enough blood supply and it's struggling to maintain its integrity. Until we get the blood supply flowing to give the bladder all the oxygen and nutrition it needs, that pelvic floor patient is probably going to be a little diet sensitive. And if you're in the widespread pain group, which is our central nervous system injury group, you're going to be exquisitely sensitive to caffeine. Anything that's neurostimulatory is going to amp up that nervous system and trigger more pain and discomfort. And so, diet is everything. Everything. It is a fundamental, basic thing we have to follow because our job, your job, is to create an environment to support healing. And the bladder doesn't heal overnight. It takes time for the bladder to heal. So again, if you had a wound on your hand, what's going to happen if you pour coffee in that wound every day? It's not going to heal. It's going to get bigger and bigger and bigger as the acid erodes the wound. So we have a lot of really good diet and information on the IC Network website at icnetwork.org. We also have we have another great website called the IC Diet Project, icdietproject.com, which has a ton of recipes. And that's like my baby. I love working on that website. We got great recipes by Julie Beyer, who's the first registered dietitian. I know there's another registered dietitian who likes to be quote unquote the IC dietitian, but the original IC dietitian, Julie Beyer, has written two phenomenal books. Customizing the IC diet is one, and then she has her cookbook. And she actually wrote a bunch of our recipes on the IC Diet Project, and so did Beverly Lauman, who wrote the book A Taste of the Good Life, a cookbook for the IC diet, which is no longer in print, but which was our Bible from 1993 to 2013, 20 years. I still have it in my shelf. Unfortunately, she just couldn't update it, so she stopped producing it. But she's that author. She was the Orange County IC support group. And I got to tell you, IC patients are amazingly diverse. I mean, we have IC patients who are politicians. We've got IC patients who are Broadway stars, film stars, TV stars. We've got housewives, we got students, you name it. F-16 squadron commanders. Pelvic injuries happen. Um, but there are some IC patients who become injured while they're in graduate school. And there are two that come to mind. One is Beverly Lauman, who ran the Orange County IC support group, who is brilliant. And I think I'm pretty darn smart. I mean, again, I've got my own graduate degrees. She's smarter than me. And talking to her is amazing. And her knowledge of the intricacies of the IC diet and why it's important is amazing. She's just kind of retired now from doing IC stuff. The other one is Dr. Jason Cush, who's at USC, and he is fascinating because he was in graduate school for like math in Chicago, like this really, really advanced doctoral research in mathematics. And he used to ride to school on a bicycle. And while he was in school, he started getting all the symptoms of IC. And then he finished that. He's now a big researcher at USC. And now he's doing big IC research. And his story is amazing because he is a pelvic injury patient, that typical pelvic floor pudendal neuralgia patient. And so I did an interview with him in our magazine like last year or the year before. And so we were talking a lot about nervous system upregulation because when you have an original injury that isn't promptly treated, there's kind of a legacy to that injury, and that is that the nervous system gets upregulated and more sensitive. And so he and I were talking because I really felt like he understood. He was one of the first where I really could have a very advanced academic discussion about neuroinflammation and kind of my life and all this sort of stuff and how do we calm the nervous system down and all this sort of stuff. And I said to him, I said, "What do you do? What do you do when you feel your nervous system amping up? Just how do you stop it?" And he surfs. He surfs. And what's amazing about surfing is he said, the thing is that when you get on a surfboard, your brain cannot pay attention to anything other than the water and the board. And it's like the perfect distraction. And so for those of you who are members of the IC network and you get our magazine, just go back on your member page to, I think it's like 2 years ago, and you'll see an interview with Jason Kutch, and that made total sense to me. The thing is that we can, when you've got widespread pain and multiple pain conditions, your consciousness kind of becomes dominated by the pain. Like William, like you, how you're feeling right now. Like you feel hopeless, as you just wrote, borderline depressed. Understandable. Believe me, I've been there. I've been there recently because of my cancer diagnosis. I totally get where you're at. And the challenge here is that, and I don't know if I can say this the right way. It's not that you're willingly obsessing with it. You're not at all. It's that the pain is a driving force, and it keeps you focused on it. And the more focused you're on it, kind of the more intense it begins. It gets. It's this kind of, I'm not describing it well. I apologize. So anyway, Dr. Kutch had gone through that. I've certainly gone through that. I'm there right now dealing with this incision pain, and it's just there, frequently. And it's like, how do I distract myself from the pain? And what he said is he gets in the water. The wind is hitting his face. You got the sound of the waves. He's balancing on the board. He's swimming in the water. He completely distracts his body from that pain. And it works. It works. And I think that becomes a challenge for us, that while we're in the process of figuring out what's wrong, getting that diagnosis, getting through treatments, trying to find that pathway for healing, it can be very easy to just dwell on the pain over. It's just like it's all you're doing. And we have to distract. You have to distract. That's why laughter is such a good way of healing, of helping that healing process. Not watching sad things, watching happy things. And I was listening to just last night a podcast by Maya Bialik, and she's smarter than I am too. She's so freaking smart. She's got her PhD in something, and this is something that she's gotten into a lot. Is the role of positivity versus negativity. That if you live in the negative, you become a self-fulfilling prophecy of failure. And that there are distinct biological changes that happen when you are constantly assuming the worst and you're catastrophizing. You're engaging fight or flight, you're changing the way your brain's functioning, all that sort of stuff, which is increasing pain perception, yada, yada, yada. If you focus instead on the positive things, then number one, the way I say it is you're telling your brain where you want to be. You're giving your brain somewhere to work for. And laughter improves brain chemistry. So I think it's really important to do fun things. Like if you were here in my town, I'd have you all over to my house and we would be playing games. We would just be doing all sorts of fun things. Anybody in Northern California, if you want to come over to my house, you're welcome. We can spend an afternoon together. I am happy to do it. Or we can meet somewhere and do it. Some people would say, don't let people into your house. I just think that community matters because you're all my brothers and my sisters. On a side note, for my pain in the nail, I've found a few new THC beverages from Total Wine. Has to be 10 milligrams. It works. Awesome. Love it. Now that's fantastic. THC, CBD. If you have medical marijuana approved in your state, uh, that's one thing. But you can also do it. You can also get it from hemp, and hemp is illegal in every single state. THC creams, CBD creams, worth a shot when you're struggling with pain. Pam says she doesn't want to leave my bed. I'm super depressed. Okay, so Pam, I'm looking at you, my dear. This is not your fault. You have done nothing wrong. I don't want you carrying any shame or any blame. You did not cause this. You're hurt. You're hurt. And our job is to try to figure out how you're hurt, where your injury is, so that we can focus on finding the right treatment for you. And that's called phenotyping. Phenotyping. And so if you want to call me this coming week, call me. I am happy to talk to you. Maybe we can try to phenotype you. The thing is I understand wanting to hide in your room because I kind of hid my room for a couple of weeks after I was diagnosed with breast cancer. You just want to hide. You want to hide from life. Your bedroom is your safe place. You just want to burrow under the covers with a cat on your bed or a dog on your bed and just please God, just give me a pathway out of here. Our challenge here is the more you lay in your bed, the weaker you get. So I'm all for staying in bed an extra hour or two. If you want to do that, that's fine. I did it this morning. I woke up at 7. I read, I watched videos for 2 hours before I finally got up at 9. Um, it's okay to chill. But the great majority of your time during the day needs to be up and moving around. Because when you move your body, you produce natural endorphins, which are pain fighting, your body's own pain fighting chemicals. So I would love for you to get out of bed and open up your front door and walk out to your street and just breathe in the air. I would love for you to take a short walk. Go up 2 houses one direction, go down 2 houses the other direction. Start slow. I don't expect you to walk a mile or a half mile. Just get out and move, breathe the air. And be mindful when you're walking. You don't want to you don't want to be listening to TikToks while you're walking. That's not helpful. Turn off the sound for a moment and listen to the birds. Listen to the healing power of nature. So feel free, Pam. I'd love to talk with you. Please feel free to give me a phone call and maybe we can come up with some questions that you can ask your doctor and maybe we can find some more effective treatments for you. Okay? You're not the only one, girl. You're not alone at all. At all. And William, you're not alone either. Nancy says, I understand the distraction thing. That's why nights are worse. Everything you are says hits home. Yeah, definitely. Mary says, how do I increase the number of stars from 99 cents to more than? I can't seem to do it. I don't know, Mary, because I've never done it. I don't know. If there's somebody out there who's done stars on Facebook, can you give her a tip on how to do it? Pam said, I've been in my bedroom for almost 4 years. Hey, Sue, nice to see you, hon. Been a while. I'm here. Look, the girls are gone. All right, Pamela, you've been in your bedroom for almost 4 years. Hmm. You, my dear, are not alone at all. Um, I'd be fascinating to talk with you. Um, do you feel like you have like massive anxiety if you leave your home? Anxiety. I so everyone is like, do you sleep all the time? But they don't understand the pain. Okay, Pamela, do you have is your pain your pelvic pain, or do you have any other pain disorders? Do you have like IBS or vulvodynia or migraines? You have any other pain disorders, or is it just your bladder pain? This is a very easy phenotyping screening question. You have low back pain and bad vaginal pain. How old are you, hun? How old are you? And you have IBS. I had terrible IBS in my 20s, girl. Terrible. How old are you? You don't have to be accurate. You can just say 20s, 30s, 40s, 50s, 60s. Okay. How old were you when this all began? How long have you had this? Just 4 years, or did you start having problems 10 years ago, 20 years ago? When did you first start having any pain condition? Thank you, MW. Really appreciate it. 9 years. Okay. Pamela, is there any event that you associate with your onset of your symptoms 9 years ago? Did you have a baby? So you would have been 37. So had you had a baby? Were you in a car accident? Had you fallen? What do you think, or what did you think might have triggered your first symptoms back then? Was there any weird event? Like, were you traveling abroad? Were you on vacation? Just what was your initial hunch? You'd be amazed at how often hunches are right. But I'm just curious, what did you think triggered your symptoms? MW had a dry birth. Yikes. And doctors have told me there's no such thing. What can you explain what a dry birth is, MW? The way you experience that? So, I mean, like, did your like your water, you lost all your okay. Wow. Okay, getting back Pamela for a moment. When did your water break? When do you think your water broke? That's amazing. So that's on YouTube. Okay, we're coming back to Facebook here. Pamela said, I was small. I always peed every little bit. Then they just said I had a small bladder for years. And the pain started for 21 days and I couldn't get out of bed for pain. Okay, Pamela, let me ask you this. Do you have very sensitive skin? Like, can you wear wool? Or are you like me? You can only wear soft cotton. Like, I can't wear polyester. I can't wear waffle knits. I can't wear flannel. My skin is so freaking sensitive. Do you have very sensitive skin? Okay. Do you have a wicked sense of smell? Can you smell things that other people can't smell, and do smells drive you crazy? Okay. Isn't it weird that I asked that question? Isn't that strange? Well, that's because you're like me. You are a chronic overlapping pain patient. So you're an IC phenotype 5. So these are the patients who have multiple pain conditions. So, for example, I had frequency urgency in junior high. I had severe vulvodynia in high school. I developed IBS in my 20s, terrible IBS. I call it bend over and screamers. I developed bladder pain in my early 30s. Oh, I developed migraines in my 20s. Thankfully, those are very short term. And when you're the patient, like you want to know why. Because I was watching my friends get married and having babies in their 20s, and I was laying in my damn bathroom in the fetal position every morning at 10 o'clock for an hour. The cramping was so bad. And when you're the patient, you're just frustrated, confused, angry, annoyed by people who say, well, you look fine. Hey, Jill, just drink some cranberry juice, it'll go away. And you start to feel like you're damaged goods. You start to feel unworthy, unlovable. And we women, especially, but men do this too. When you don't have an easy answer, the self talk going on in our brain is just remarkable because we start thinking that we're unworthy. We start thinking that we're unlovable. Okay. So I will tell you that it became the mystery of my life. And one of the reasons why I got the degrees that I got is I wanted to know what the hell was wrong with my body. Interestingly, at the same time in my 20s, I developed very severe anxiety disorder. Very severe. I understand you not wanting to leave your home. Just driving into town was hard. It felt like I was driving 100 miles when I was only driving 5 miles. I used to have a lot of panic attacks. Emphasis on used to. I haven't had a panic attack in uh, 28 years. But I panicked every time I had to go to the doctor. I panicked if I had to take a trip. I had panicked if I had to take a long car ride. So here's what's interesting. Because you're my sister. Literally, you're my sister here. So about 10 years ago, okay, MW says me too. Okay. So you guys, this can sound scary, but it's not scary at all. There's a very, very happy ending. Okay. So about 10 years ago, all the different patient groups got together. The TMJ group, the BOW group, you name it, they all got together except for the IC groups. They didn't. That's a whole nother story. But anyway, all the other pain groups got together and they created a research team called the Chronic Pain Research Alliance. Phenomenal research team. And their job is to try to understand why some people got widespread pain. Okay. Because when it's you, the patient, you're going, God, really? You've given me 10 different painful diseases? Huh? What the hell did I deserve to get all these painful conditions? Well, okay, it's not 10 different conditions. It's actually the nervous system. So what this research team did is they started looking at nerves throughout the body. The regional nerves like hands, feet, all that sort of stuff. Then they started looking at the spinal cord because all those nerves feed into the spinal cord. Then they started looking at the brain. And this is the part that's going to sound scary, but it's not. Totally not. You do not need to freak out about this at all. Okay. Here's what they found. The patients with widespread pain have a brain that is stuck in fight or flight. That's where the anxiety is coming from. So the amygdala, which is the command and control center of fight or flight, is on 24 hours a day. So fight or flight is controlled by the brainstem, the most primitive part of your brain. It has one job: to save your life. So the brainstem monitors all your sensory information. What do you see? What do you hear? What do you smell? It's looking for threats. And when it finds a threat, it takes over the brain. The amygdala turns on, and what does it do? It raises your heart rate, it raises your blood pressure, it tightens your muscles to prepare you to run or flee or fight for your life or freeze. So, if, for example, you see a fire racing towards your house and you smell the smoke, that happened just a couple days ago, or you hear the bomber planes. Okay. Immediately your brain goes, uh oh, threat, takes over, raises your heart rate, raises your blood pressure, and you immediately go on alert looking for the threat. So you see the fire, but you call the fire department, they come out, they put it out, the threat is gone. 2 hours later, the threat is gone. You don't need fight or flight, and normally it turns itself off. And then the sympathetic nervous system regains control of the brain and it lowers your heart rate, it lowers your blood pressure, it relaxes your muscles. But what the chronic research people found is that for those of us who have had widespread pain, it's not turning off, that we're stuck there. And the reason why you're so anxious is because your brain thinks your life is at stake. It's what happens after injuries. So so the question is, why does this happen? And then I will share what happened to me. Okay. For 80% of the people and children who develop widespread pain, but it can also be adults, there is a major physical injury, a big time injury, like breaking a leg, breaking a hip, being in a car accident. It takes 14 days of pain to put the brain into a constant state of fight or flight. So for 80%, this is the result of a physical injury. One of the classic physical injuries is falling on your tailbone, falling on your hip, things like that. And especially if there's a history of trauma, a history of falls over time. Now, for the other 20%, it's a history of bullying or abuse. So let me tell you what happened to me, because I had both. I had the injury. I broke my tailbone in fourth grade. I mean, in seventh grade. But when I was in fourth grade, I was attacked by a rapist and murderer. I was physically attacked. This was a kid who was in my neighborhood who was severely mentally ill. We're talking the one who finds the cats and kills them. I did not leave my home without fear through high school. And the year I went away to college, he raped and murdered my neighbor, and tried to murder her fiance. Didn't manage to kill him, killed her. Now, I want you to think about what that did to my brain, because my only safe place was my home. And as soon as my mom woke me up to go to school, my brain went into fight or flight. And I had to walk to school. Like, how many blocks? One, two, probably 6 blocks to school. And he was walking behind me because he was 2 blocks that way. The closer I got to school, the more hypervigilant I became. At school all day, I was looking over my shoulder in fear. And the worst part was when school got out and I had to run as fast as I could home, because that's when I got attacked. Okay, that was not one day. That was every school day for a decade. And I legitimately was in danger. I was a child that was in danger. It shouldn't have happened to me. And it's one of the reasons why I'm not married, because I have never been able to trust a man because I was hurt so badly at such a young age. It's the truth. Absolute truth. I've come close, but my brain remembers everything. So when I do coaching with patients and we start probing about what we call an adverse childhood event or trauma, the most classic case that comes up over and over and over again are children who are raised by alcoholics. There was alcoholism in the home, or there was physical violence or emotional violence in the home. Oh, hon, he's had multiple, he's a lifer, multiple attacks. I mean, that's a whole nother story. And I've forgiven him. I think he grew up as with fetal alcohol syndrome because his parents were very, very, very bad alcoholics. So believe it or not, I've actually forgiven him, even though it completely changed the course of my life. Okay, so in my office, one of the most consistent trauma that we see is growing up in a home with an alcoholic or growing up in a home with somebody who is emotionally abusive. And one of the patients that I was working with, because and I'm much more aware of childhood trauma than I ever was before. I mean, like, I thought I was the only one, and it's so common. It's just so, and again, not my fault, not your fault. I didn't do a damn thing wrong. I didn't do a damn thing wrong. I did nothing wrong to deserve this. I was hurt badly, consistently over time. So there is this one woman that I was working with. She was in her 50s, and her father was a violent alcoholic. And so when he got home and started drinking, they locked themselves in the bathroom. And every night he broke into the bathroom and beat them. And that went on for years. So she had the same thing. So whether it's physical injury or abuse or bullying, it takes 21 days of abuse or bullying to put the brain into a constant state of fight or flight. Okay. So what does extended fight or flight do? Number one, it locks your muscles down really tight. Number two, it makes your nerves very, very sensitive. And number three, you get stuck in this loop of anxiety. So now that we've identified this phenotype, and everybody's, not just me, it's the big top researchers. They all say the widespread pain group is a very distinct group. Our treatment is very different and it works, and I'm pain free now. I'm pretty much anxiety free, except that, the breast cancer triggered a few things. But I don't have IC anymore. I don't have IBS anymore. I don't have vulvodynia anymore. My sensitive skin is virtually gone now. Why? Because I turned fight or flight off in my brain. Takes 5 minutes. I can teach you how to do it. We can do it right now. So for patients with widespread pain, we know bladder therapies are not going to work because it's the central nervous system that's a problem. What we're going to do is teach that nervous system to calm itself down again. That there's no reason for it to be upset. Something happened that tweaked it. Now we're going to calm it back down. So, is this making any sense at all, Pamela? What do you think of what I'm saying so far? And I'm going to teach you the technique that worked for me. And once I got myself out of fight or flight, oh my God, everything changed. I was in fight or flight. I took my class at 35. I went into fight or flight in 4th grade. I was in fight or flight for 30 years after that first injury. 30 years. Okay, so so there's 2 steps to this process. I always have to think about how I want to say it. Super easy. So our target is the brainstem. Our target is the brainstem. Again, 24 hours a day, the brainstem is monitoring sensory information. And if it senses something that's threatening, it takes charge of your nervous system. So, what we're going to do is prove to your brainstem that at this moment you are safe and there is no reason for you to be in fight or flight. And we're going to use a technique called I Spy. And this was a technique that I believe was developed at Harvard. I learned it at an International Pelvic Pain Society conference 3 years ago. I do it every day with patients on the phone when I'm working. So what we're going and you can't think yourself out of fight or flight. Your cognition does not switch fight or flight. Fight or flight is very basic. It's just senses. So we're going to do a technique that's going to focus on sensory information. So let's just take 2 deep breaths. Let's just go in and out. And let's do it again. We're going to go in and out. Okay. We're going to do the sense of sight first. I want you to look in your environment. Doesn't matter if it's in your bedroom or out the window. And I want you to pick something that you like. So I've got a really pretty painting on the wall that my neighbor did. Love it, love it, love it. I want you to look at something that you enjoy. Could be a cat on your bed, could be a candle, whatever. Pick something that is pleasant. And let's just look at it for a couple of seconds. Here. I'll give you my cat painting. Look at my cat painting for a couple of seconds. Okay, take a deep breath. In for 3 and out for 3. Okay. Now, besides my voice, what do you hear? What do you hear? Do you hear TV on? Do you hear the wind? Do you hear a fan, a furnace? Just take a moment and it's okay if you don't hear anything. It's okay. But just take a moment and listen to your environment. All I hear is my ringing ear. Deep breath in, deep breath out. Okay, now we're going to do the sense of smell. Can you smell anything? Take a moment and just smell. Any smells in the room? I have a little smell of watermelon because this is a little very diluted watermelon juice. I can smell that. So take a moment and just smell your environment, just a couple of seconds. Okay. Deep breath in, deep breath out. Okay, now let's go for flavors in your mouth, the sense of taste. Can you taste anything? I can taste a little bit of watermelon. Tastes good. Are there any flavors in your mouth? And it's okay if there aren't. It's okay. Just say no. Okay. Deep breath in. Deep breath out. Now we're going to do the sense of touch. I want you to take your hand and I want you to rub it up and down your thigh. 10 times. Up and down your thigh. Okay, this really has your brain working. Your brain's going, wasn't that interesting? It's soft, it feels good. You're really lighting up your brain when you're doing that. Okay. Deep breath in, deep breath out. Okay, now comes the fun part. And I'm telling you right now, it's never not worked. And I've done it hundreds of times with patients. If you could look at anything that would put an immediate smile on your face, what would that be? Would it be the ocean, ocean waves? Would it be a kitten? Would it be a grandchild? Would it be a waterfall? What would you just love to look at right now that would make you happy? I'm going to pick a beach in Hawaii, the Kahala Beach in Hawaii. It's a quiet beach. The locals go, the tourists don't know about it. I had family there. That's how I learned about it. It's a small little beach, nice warm sun, sitting on the beach, watching the waves come in and watching the pelicans fly by. So I want you to close your eyes and pick your scene. What would you just love to look at right now that would just make you so peacefully happy? Okay, close your eyes and visualize it. Okay, deep breath in, deep breath out. Okay, what could you listen to that would put an immediate smile on your face? Would it be again the sound of the ocean waves? Would it be your favorite music? Would it be birds, wind chimes? What's your favorite thing to listen to? Somebody laughing? Close your so I like Kenny Loggins and I love the Pooh song, Winnie the Pooh doesn't know what to do. Got a honey jar stuck on his nose. Listen, I'm 64 years old. I love the Pooh song. Makes me happy every time. Okay, close your eyes and I want you to visualize your favorite sound just for a couple of seconds. Okay. Deep breath in, deep breath out. Okay. What's your favorite smell? What would you just love to smell? What would you love to smell? For me, every single time, it's baking cinnamon rolls. If I got cinnamon rolls baking in the oven, I'm a happy girl. Sometimes I bake things in the oven. I'm not going to eat them because I'm dieting, but I'm going to bake them anyway because I'm going to fill up my home with the smell I love. Close your eyes and visualize something you love to smell. It might be roses, might be cinnamon rolls, might be your dog or your cat, might be your lover. Just close your eyes. Lavender. Visualize your favorite smell. Okay. Deep breath in, deep breath out. Okay. Now, what's your favorite flavor? If you could eat anything, what would just, and I don't mention IC, I don't care about IC at all or the IC diet. If you could eat anything that would make you immediately happy and blissful, what would it be? Would it be a big piece of chocolate cake? Would it be a steak? Would it be cinnamon roll, apple pie, lemonade? What would you just love to eat that would just take you to a really happy place in your heart? For me, every single time, it's that hot cinnamon roll. It's on a plate in front of me. It's steaming. It's all gooey. The frosting is melting. You take your first bite, put it in your mouth, and it's just, oh, I'm home. Oh, if only I could eat it all day. If only I had protein in it. Close your eyes and visualize your favorite food. Okay. And the taste is so good. Yum. And your mom made it. Favorite foods from childhood? Deep breath in, deep breath out. I was just thinking that I had a little pillow that I carried when I was very young, and it smelled like maple syrup because I'd apparently eaten pancakes with maple syrup and then rolled on it, and it was forever scented by maple syrup, and so maple syrup always makes me very happy and very safe. Okay, last but not least, what could you touch that would put an immediate smile on your face? What could you touch? Would it be warm sand at the beach? Would it be a kitten, a cat, a dog? Would it be your lover? Would it be the hair of your grandchild? What would you just love to touch that would make you very, very happy? I want you to close your eyes and visualize it. I'm going, the wind is a little cool and brisk at the beach, but the sand is warm. And you put your fingers into the sand and it's just warm and comforting. So that's what I'm feeling right now. Okay. Deep breath in, deep breath out. Okay. How do you feel? For those of you who did that, how do you feel? I bet you got a smile on your face. That technique turns off fight or flight completely. It'll stay off for hours. The foundation of any good pain management program is a very simple technique that will just relax everything. Mindfulness. That's a typical mindfulness program. Works every single time. So that's technique number one, Pam, is every day doing that guided relaxation and reminding your brain you're safe because you are safe. I'm safe. He's in jail. He'd be in jail for the rest of his life. Okay. But like you wrote when we were doing that, you also have severe anxiety. I also had emphasis on had very severe anxiety. I was scared to death every day. And when they called me and told me he raped and murdered my neighbor, I knew that would have been me. I knew it. I fell to the ground and I don't remember what I did. I might have wailed in my dorm at college. I understand being very, very anxious. So, and that led me to move my career from pharmacology to psychology. And I have a master's degree in psychology. And I was going on for my PhD when a lot of the IBS and stuff was going on. And even after I got after I got my master's degree, I was still having panic attacks. And finally, one day, I just cried uncle. I just like, God, I am so freaking sick of this. Obviously, I am missing a skill here. And so I signed up for an anxiety management class that completely changed my life. And I learned a very simple technique in that class that transformed everything. And I have not had a single panic attack since I've taken that class. So, what was fascinating about this class, the class was called Phobies, like phobia, only with an EASE at the end, Phobies. You can still find some of the old class materials, I think, on Amazon. They're very old. It was developed by a surgeon with anxiety disorder, and his son had anxiety disorder. So, he did it for his son. So, the first thing, the first good thing that happened was literally, and of course, I had a panic attack before the class because it was at the hospital, and anyway, I got myself there anyway. And in the first 5 minutes, the first big thing happened that changed me because when you met other people with anxiety disorder, you realized that we were all normal people who had had something bad happen to us. Like up to that point, I really thought that like I was a walking poster child for being really messed up. And that I believed that I was very abnormal. And when I actually met other people with severe anxiety, it was like, "Oh, you too? What, you too? Really?" And what was interesting is one of the people in my class was actually the first family who won the first lottery in the state of California. And they developed anxiety disorder after winning the lottery. And it became a very powerful message that I was a completely normal person who had had something bad happen to me. And that took away all the shame. I was so ashamed before that. And it's like, wow, really? Oh, okay. It wasn't my fault. I was hurt badly. So that was important for my state of mind because all the shame just flowed off my body literally in the first 5 or 10 minutes of class. Then the instructor said, "How many of you say no to everything? Every invitation. Hey, Jill, you want to go take a drive? No. You want to go out to eat? No. You want to go to a movie? No, I don't want to go to a movie. You want? No, I don't." Now, I wanted to accept all those invitations. My brain immediately said no. And I'd asked a lot of doctors, why am I doing that? Why does my brain say no to everything? And their answer is you're in fight or flight. That's your brain trying to keep you home and safe. That's an extended reaction to fight or flight. Like, oh, okay, again, not my fault. Okay, fascinating. And then he said, "How many of you are super sensitive, really sensitive to chemicals?" And like the whole class raises their hand again. And we all raised our hands for the no. We say no to everything. And we all raised our hands for, yeah, he goes, "You know how you're sensitive to chemicals on the outside? You're also really sensitive to chemicals on the inside." And he said, "Right now, you are literally overdosing on adrenaline. You have so much adrenaline floating through your body that's what's driving the panic. That's what's driving the tears. That's what's driving all of this is this massive amount of adrenaline." Like, okay. And he said, "How many of you have negative thoughts?" Every other thought was a negative thought back then. "How many of you catastrophize?" "Hey, is the earthquake going to happen? Ooh, it's going to be a big one. My house is going to fall down." Classic catastrophizing. Well, here's the challenge. Whenever you have a negative thought, you give yourself a jolt of adrenaline. That's the negative thought of, hey, the earthquake's going to happen, triggers fight or flight again. The chemical mediator of fight or flight is adrenaline. The problem is you don't just have one negative thought a day, you have 100, 200. That's 100 shots of adrenaline going through the bloodstream. It's a massive stimulant. That is the chemical mediator of all of this panic, all of this anxiety is this adrenaline. So he said, the secret to controlling anxiety is to control the adrenaline. If we can get you out of adrenaline overload, your entire nervous system will calm down. And I'm like, okay, how do we do it? He goes, it's really easy. Oxygen. Oxygen turns off adrenaline. Okay. And he taught us a 3-step technique. I've used it for 30 years. Works every time. He said, whenever you have a negative thought, the first thing you do is you visualize a stop sign. That thought of, I'll never get better. I'll always live with pain. That's a negative thought. So you visualize the stop sign. Just stop, for God's sake. I don't want to hear it anymore. Stop it for a moment. Then you take a single deep breath in for 3 and out for 3. And that oxygen has just rendered the adrenaline from that negative thought chemically neutral. It is done. It is over. It is gone. So stop sign, deep breath. And the third thing is you have to remind yourself it's a thought. It has no power. It's just your brain guarding you. So what I say to myself is, oh my God, Jill, you're not God. You can't predict the future. For all you know, tomorrow's going to be a great day. It's just a thought. It's just your brain guarding. It has no reality. It's not real. Or it has no power. Stop sign, deep breath, minimize the thought. Okay. So the instructor said, okay, we have one goal for the first week. All we want to do is bring down the level of adrenaline in your bloodstream. That's all we want to do. We want to get you down neutral. So as for this next week, I want you to be very attentive to your negative thoughts, and I want you to do it. Every time you have a negative thought, stop sign, deep breath, minimize the thought. And again, I'm a scientist. Made total sense to me. I'm like, I'm in. I'll do it. Absolutely, I'll do it. Had my first negative thought walking out of the room. Oh my God, this is stupid. It'll never work. But I did it. I did it. Yeah, hold that thought, Diane. Um, that first day, I did it at least 100 times. At least. The next day, I did it about 50 times. The next day, I did it about 20 times. 5 days later, I only had to do it once. And for the first time since I was attacked by a rapist and murderer in 4th grade, I'm now 35 when I took that class. For the first time, I was out of fight or flight and calm. It was mind blowing that all that time, all those symptoms were being driven by adrenaline overload from that original trauma. Stop sign, deep breath, minimize the thought. Now, I will tell you that it worked quickly for me. Within a month or 2, I was noticeably better. And I'm not lying. My bladder pain got massively better. My IBS disappeared. My vulvodynia disappeared. My skin got better. Everything got better once I got my brain out of fight or flight. Not lying. I also am very assertive about how I live. I live in a very happy home. I have things around me that make me happy. You can see a sign that says love. I've got a lighted sign that says love. I've got butterflies everywhere. You name it, I've got it. The worst thing you could do for me is put me in a dark room. The windows are open, the sun is shining in. And I love my affirmations. I can do all things through Christ who strengthens me. I can get through breast cancer surgery. That was my affirmation, because Christ strengthens me. Or insert whatever faith you have. And every day, in every way, my life will get better. I practice those affirmations. I'm not going to dwell on the negative. I'm going to be very assertive and aggressive and focus on positivity. Because I don't want to live in the negative anymore. I lived there for too long. I want to live in the joy. And I will tell you, I got to the point where I had hundreds of negative thoughts a day to one a month for 25 years. And then COVID hit, and the negative thoughts came back. I mean, but they never got out of control because I knew what to do. Stop sign, deep breath, minimize the thought. If I have one negative thought, yeah, I'll let it go. 2 in a row, That's 2 shots of adrenaline. That's too many. I immediately do stop sign, deep breath, minimize thought. Very rare I ever have 3 in a row. So I double dog dare you, Pamela, to do it for a week, because that's how I got out of my house. Is I let I understood the biology of panic and that you get stuck in a loop of adrenaline overload. So we have to break that down, and we do that with oxygen. So give it a shot. If you want to talk about it, feel free to call me. I've got a video on our website. I see an anxiety that reinforces that too. Most importantly, you have done nothing wrong. This is not your fault. No shame, no blame. Sisters, I've been there. A lot of us have been there. 40% of IC patients are in this group. Well, 37% are in this group. You didn't do anything wrong. I want you to hold your head up high. I want you to look in the mirror and be damn proud of yourself because you've been through hell and we're going to get better. And yeah, it sucks that you're in pain. It's terrible pain. We all understand terrible pain. But there is hope. When we calm that nervous system down, it improves tremendously. So if you need a pep talk, you know who to call. I would love to talk with you. If you're struggling with depression, it's also really important to have somebody that you can talk with, a psychologist, a psychiatrist, a good friend, a religious figure, whoever. Don't let the anger and the fear and the stress dwell in your body. You have to have a way of letting it go. I did a lot of journaling. And the rule of journaling for me is I would start the morning writing 2 pages longhand in a small journal, not a big paper, just a small journal. Wrote down all my fears and worries about that day. Just got it out. Just like done. I want to get it out of my heart and out of my body before I even get up. And then at the end of the day, as I was laying in bed, go to bed, I do the same thing. Just like get it all out. I don't want it to live in here. Just get it all out. And then what you do, you don't reread it. The point is not to reread it. You don't have to reread it. You never reread it. It's just about cleansing your soul. So once a week, you just burn it. Just let it go. All those stresses. And the other thing too, I think that is one of the blessings of getting older is that you learn you learn to pick your battles. You just don't have to get involved in other people's stuff. People are having a bad day. It doesn't mean you have to have a bad day. And that's where social networking is really harmful because it keeps you all worked up. It's very important that you get off of social networking. You don't, it doesn't matter if Jennifer and Ben are breaking up. It doesn't matter to your life. It doesn't matter to see people fighting. Cleanse it up. Do fun things instead. All right, let's go back to your question. So that's for, again, widespread pain. Thank you for listening to me with my technique. I'm telling you, it changed my life. Okay, Captain Obvious. Love your name, Captain Obvious. I was in here earlier when you cautioned be kind. I have a friend going through the same thing. What's your biggest hesitation about InterStem? Oh God, there are a couple. Number one, it's very, very, very important that you get in writing from your insurance company that it is covered. So one of the patients that I worked with was a nurse who lived in a small town back east, and there were 3 urologists in town. They all refused to treat her. They all said, "You've got to have InterStem." She felt very pressured to have it done, but they all said, "We won't do anything for you until you have InterStem." So because she was a nurse, she wasn't naive. So she talked to the billing officer, billing office in the doctor's office, urologist's office. They said, "Yeah, you're covered. Doesn't need any written pre-authorization." She's like, "Okay." Then she called the hospital that she happened to work at, talked to their billing office, said, "Is this covered?" They went, "Yeah, not a problem. No written pre-authorization is required." Then she did her due diligence and she called the actual insurance company and said, "Is this covered for me?" And they went, "Absolutely, you're fine." She didn't get it in writing. A week after surgery, she had a threat to garnish her wages and a bill for $80,000. She's not the only one. So I always tell everybody who's considering InterStem or neuromodulation, you get in writing from the company, from everybody, that this is covered by your health insurance. And if they refuse to give it in writing, I would not do it. Or you have to ask, I mean, listen, if you're wealthy and you can handle a bill for 50, 60, 70K, go for it. Most people can't do that. So that's hesitation number one. Is it covered? Hesitation number two, what happens if you lose your health insurance? So the thing about InterStem is that it requires constant care. So it's not like it's one and done, you go on your way. It doesn't work that way. The device has to be checked, monitored, potentially reprogrammed. And the device can also malfunction. And so it's all happy when you have health insurance. But if you lose your health insurance, will that same doctor still maintain your device? And the answer is often no. And so this was a patient in Florida who had good insurance, had it done, lost her job, lost her insurance. Her device started to malfunction badly, and it was shocking her. She called the urologist. Urologist refused to see her. So she's literally being shocked by the device and she has nowhere to go. So she calls me. Oh my, what do I do, Jill? What do I do? So what we did is we went back to the company and we said, hey, you facilitated this being put in her body. You're the one who's saying it needs care. Can you find her a doctor? It turned out in the entire state of Florida, there was only one doctor who would take Medicaid. One. So if you don't have health insurance, it's not good. And if there's a threat that you'll lose your health insurance, it's also not good. And so I would be asking that doctor, will you care for me if I lose my health insurance? And if he or she says no, your answer is going to be, then who would? And if the doctor says, I don't know, then you're going to say, then I don't know if I want to have this done. You're going to have to reassure me. And then last but not least, the actual complication rate from the implants filed with the US government FDA is astonishing. And I honestly do not understand why they haven't launched an investigation into thousands of adverse event reports. I mean, how many adverse event reports do you need before you go, maybe there's a problem? But when you look even more closely at that data, what you see are fatalities. That there are 20 fatalities associated with InterStem. And the problem with the FDA database is they report the death, but they don't necessarily report why the death occurred. All they say is just associated with the device. So the last fatality, I think was last December. And it was either last December or a year ago last December. And it was a patient who had InterStem. Doctor moved away. The device became severely infected. The infection was apparently massive. And the emergency team had really no experience in how to deal with it, and the patient died of a gross infection. So that access to consistent medical care is vital. In this case, the doctor closed their office and moved away. The patient suffered what became a fatal adverse event. So, and interestingly, and it's so hard because I work with a lot of researchers and I disagree with some and I agree with some. We had a paper that was just published that talked about the safety of InterStem based upon the FDA reports. And I have to feel, and to some degree, that was maybe promoted by some of my discussion about InterStem. And so what they did is, out of the very large number of reports that have been filed, they picked 1,000. And then they made assumptions based upon those 1,000. But none of the fatalities were in the 1,000 sample that they used. So their conclusion was that it's remarkably safe. And I disagree with that. The FDA database disagrees with that. And I personally want to know why patients have died. In one case, somebody's heart matched the rhythm of the stimulation device. So when the device went off, her heart went off. So I would like to see more study of those cases. Obviously, InterStim advocates disagree with me. But anyway, it is what it is. MW says, morning anxiety is tough. I've just woken up in Australia, sitting in the sun, listening to you. Laura said, sadly, lactoferrin from bovine you can't take, but people with dairy allergies or lactose intolerance. Exactly, hun. Well, it's a protein. No, I'm not sure. I'm not sure if the lactoferrin molecule, protein molecule, is the molecule that also triggers lactose. I don't know, honey. I just don't know. And if you have, I mean, obviously, everybody has to research it for themselves. I'm not sure if that's the ingredient that would trigger the allergy. I just don't know. Okay. Matt says, the temporary implant didn't work for me. That was a precursor to InterStim. Eventually, it was revealed my problem wasn't the bladder itself, but a tight pelvic floor muscle. Thank you. This is why we phenotype. And aren't you glad that you didn't go through it? Aren't you glad that you did not endure multiple surgeries for something that was fixed with physical therapy? Because pelvic floor physical therapy is the single most effective treatment ever. And that's proven in research that pelvic floor physical therapy has like a 60 to 70% effectiveness, whereas typical bladder therapies are at placebo or in the 30s. So, and that matches with our demographics because we now think that 85% of IC patients are neuromuscular in origin. Sorry. My incisions are just like, oh, I moved. Okay. Captain Obvious said, do you know why it works for some and not for others? Which one? InterStim? Well, it's about phenotype, honey. The people that it's working for, it matches their phenotype. You know, Curtis Nickel, when he proposed here, hold on a sec. He proposed 9 phenotypes for IC. I use Chris Payne's five phenotypes. Well, Curtis Nickel last year said, I think that there's 9 distinct groups. And then he published his recipes for treatment. And let's see where he put, I don't remember off the top of my head which phenotype he put neuromodulation. I have an appointment for my breast cancer support group for Tuesday at 4:30. Okay. Thank you for the text. It's very weird being in a support group where I'm the patient and not the leader. I mean, it's good to be there, but they could do parts of it better. Okay. Okay, so hold on a sec. Let me see. So I'm going back to our website, to our subtype phenotype page, to his section on 9. So he believes there's inflammatory IC BPS, where the rescue installations are going to be the most effective, and for patients who don't respond to treatment, cyclosporin. His second group is infection-mediated IC. He said that there are patients who have a history of recurring UTIs that may be experiencing a bladder hypersensitivity syndrome secondary to the infection. And he suggested rather than doing oral antibiotics, doing antibiotics in bladder installation, putting the antibiotic directly in the bladder via a bladder installation. And then he also had been doing a lot of the research on the new UTI vaccines called MV140. And let me tell you, that's going to be a game changer. To be able to have a vaccine against typical UTIs, can you imagine the millions of patients that's going to help? Um, and there are 2 or 3 different vaccines currently in testing, but the early data is really spectacular. So we're going to have that soon. And he's the one. I mean, Curtis Nickel is a top IC researcher in Canada. US government paid him a lot of money for his IC research. He's a brilliant writer. I read everything he does because he's just so incredibly good. He's very close to retiring now, but this was his last big paper. So he gave a speech at the American International Urology Conference where he said next generation testing is the future. Okay, his third subtype is neurogenic hypersensitivity. So these are the patients with widespread pain. The goal of therapy is to calm the nerves in the bladder wall and the central nervous system. These patients may benefit from the use of a low dose antidepressant and bladder installations that support the gag layer. And if pain is present, to add lidocaine to the installation to calm the nerve. So that really is a good context on why a low dose antidepressant can be helpful for some. I was too sensitive. I couldn't take any of them. I had really bad reactions to Elavil. So, but now we know we have a better context as to why an antidepressant makes a little bit of sense because it acts to calm the nerve system. Okay, his fourth group, multiple allergies. These are the patients who struggle with respiratory, environmental, and dietary allergies. He said you can easily identify this during a cystoscopy by poking the bladder wall with the tip of a cystoscope. And if it has a specific reaction, we know we're dealing with an allergenic response. So these are the patients he suggested take the antihistamines. His next group is pelvic floor pain. And they're the ones who get the physical therapy. Pain is localized to one side or the other and appears to follow nerve pathways and nerve blocks. And maybe Botox therapy in the tight muscle. Okay, his next group, you notice, still haven't mentioned interstem. It's this next group that he calls primary storage symptom syndrome. Some IC patients run to the restroom to reduce pain. Their frequency and urgency is driven by avoiding the pain caused by bladder filling. Dr. Nickel believes that these patients can benefit from antimuscarinic medication, like mirabegron. He believes that bladder training can increase bladder capacity. As a last resort, Botox can provide short-term symptom relief, though it carries a risk of retention. And he said sacral neuromodulation has helped some of these patients, but he did not believe it significantly improved pain. Then he's got a urethral pain group, he's got a pain with intimacy group, and then he's got the patients who are struggling with flares. So I think that the market for neuromodulation has shrunk tremendously. Much to the regret of the people making money off of them. Hi, Heggy. Nice to see you, hun. Pamela, you'll have to call me. You'll have to call me and we'll have to talk. I can't promise you a free bottle because I only had one. And I've worked with William before. I haven't worked with you before, but if you and I talk and I get a better sense of what's going on, we'll see. Maybe. Or maybe I'll be able to give you a really big discount. We'll see. So, phone number at the top of our website, icnetwork.org. MW on YouTube says, my pelvic physio says to do my squeezing, but it brings on pain. No, you're not supposed to squeeze. If you have a physical therapist telling you to do a Kegel, they're not trained. They're not trained. You're not supposed to do Kegels. You're not supposed to do tightening when you have hypertonic pelvic floor muscles. You're supposed to relax to release them. And our guidelines say that. If anybody says to do Kegels, they're not trained. Um, yeah. All right. Well, look at that. We've just made another hour go by quickly. All right, my friends. Well, it's so I've been on for 3.5 hours, and my incisions are starting to pull. So, it is my intention. So, okay, I'm giving you homework. Please, please, please. I see Awareness Month. I need your help. We need your help. Please go over to icawareness.org. There is a press release. There are daily facts. You can send the daily facts through your social networking. Please help us spread the word, because there are patients out there who are suffering because they don't know the new stuff. They don't know about the phenotypes. We want to ease their suffering, but it begins with education. And I need every one of you in your own little way to just try to spread the word. So I've got a lot of ways that you can do that. You can share a daily fact. I've got videos. You can share IC awareness videos. You can make posters. You can make memes. Um, you can share your story. I would love to hear your story. The more stories we get, the better we are at understanding this. And then I can identify people that I think I might be able to help a little bit more, at least give them a little bit of hope. So please go on over to IC Awareness Month and help us. Because listen, if not you, who? Because IC Awareness Month isn't me. It's all of us together. And I'm recovering from surgery and we're in fire season. And so September is a hard month for me. I've had to evacuate for a week at a time in September. So I really, really need y'all to carry the load a little bit. Okay. So here's my intention. We have our master class. It's free. It's on YouTube. I have a lot more videos that I'm going to be adding. My last video was on pudendal neuralgia. So you'll be seeing more videos from me quickly. Number two, I am going to try to do a meeting midweek, either on Facebook or Instagram. I can't give you a specific time because every day is different. But if I'm done with my regular work tasks and I've got an hour or two in there that I can just go, hey, let's open up the stream and see if there's anybody who needs help. So make sure you follow me if you can on Instagram. Just search for IC Network Jill and on YouTube and Facebook. That would be great. And then last but not least, if this is helpful at all, please become a member. I mean, the only way I can do these and pay the bills and send out free stuff is through our memberships. And so that's what pays the bills, like the internet bill. So, and I do my best work in my magazine, and that's what our members get. Our members get our IC Optimist magazine along with a bunch of freebies like books and stuff. So anyway, you can learn about that more on the IC Network website. So anyway, all right. Well, I think we'll end it now. Be well. Have a wonderful week, and I hopefully will see you again next Sunday. Knock on wood. Positive thoughts. It's going to be a great week. We'll sure see you on Sunday with good news to share. And if you need to call, give me a phone call. Okay? All right, guys. I'll talk to you later. Bye, YouTube.